Good morning. Let me try that one more time. Good morning. That's so much better. Guys, what a wonderful day yesterday, right? Yeah, it was great. Let's give a hand for all of our speakers yesterday. That was such a great morning or afternoon. And I have to say, I have to really thank all of you because you were all really tremendous in asking your questions and coming up and making sure that we were keeping a really great dialogue. And I was so pleased to see all of the great networking that was going on yesterday. Can we also give a hand to BD for that wonderful breakfast we just had this morning? Wow, that was terrific. I want to share with you 5 things that I took away yesterday, and I'd love to hear on Twitter all of your different takeaways as well. But the 5 things I took away. 1, the value of sleep and the myth of the inevitability of burnout. I took that to bed with me last night, literally. Secondly, we really heard a lot about the close interdependency between health and wealth, and that really our communities can't thrive without both, and that there's a real virtuous cycle there. Thirdly, a lot about the power of role models and the opportunity that we have as leaders to lead by example. And that we don't really have to think necessarily about huge programs, but just changing our own behaviors in little ways and modeling those behaviors for others can make a huge impact in their lives and ours. Fourth, we heard a lot about the power of partnerships and the importance of businesses taking a leading role in their communities. And I think we're going to hear a lot more about that today, and I'm really excited to really get into some in-depth discussions about those partnerships. And lastly, we heard a lot about the need to just get going, to try things, to experiment, and to think small in 2 different ways. Small in that just trying new small programs, but also, and this is particularly for the NGOs and the governments in the audience, think about small businesses. We oftentimes think about this as being stuff that big companies can do. There's a lot that small businesses can do, so we should focus on that. We've got a terrific program coming up today. We've got the Washington Redskins. We're going to hear from Samsung, Sodexo, Aramark, PepsiCo, PBS, Discovery Education, the Children's Health Fund, and so much more. But the real capper today will be the Healthy 10 Awards. And that's going to be our very last thing today. It's going to be hosted by Byron Pitts, the co-anchor of ABC's Nightline. There's going to be some terrific giveaways and prizes. So I don't know what your plans are after the session's in, but you better stick around for the Healthy 10 Awards because it's going to be terrific. And you're going to get to hear a lot of some great examples that you can all take home to others. Before we get started, just a couple of housekeeping notes. Again, remember, silence those cell phones. Join us on Twitter. Our handle's at HealthMeansBiz. That's at HealthMeansBiz, B-I-Z with a Z, on Twitter. You can also follow the conversation online at #OpportunityForHealth, the word opportunity, the number 4, health. If you haven't already, download that guidebook app, search on Health Means Business. You can see all of our stuff there. And I want to, again, acknowledge and thank our tremendous, tremendous sponsor for the entire campaign, Robert Wood Johnson Foundation. Can you give them a hand, please? And again, our event sponsors, BD, Medtronic, and our contributing sponsors, Chobani, Seaforce, Delos, Kind Snacks, Mondelez International Foundation, PepsiCo, SoulCycle, Stanton Chase, and Thrive Market. Give them a hand, please. And we're again joined as our media partner in today's event, the USA Today and Washington Examiner. And again, all of your event proceeds go to the benefit of DC Central Kitchen and YMCA of Greater Washington. With that, folks, it's my real honor to welcome back to the stage the Executive Director of the Health Means Business Campaign, Elise Cohen.
Richard and I were joking yesterday when we have slight similarities in our remarks, and of course we always look at all the sets of remarks, but in my head I thought, okay, should I repeat some of the stuff he just said, or has it sunk in by this point? So I ripped out the first page. So as we saw yesterday, the momentum in the business community to take action to build healthier communities is strong, and we hope to make it even stronger. We're at a turning point in this work where business, health, purpose, and profit are truly coming together. It won't be a surprise to you that a lot of what needs to happen has little to do with doctors or healthcare. Before people end up at a doctor's office, they live in environments that enable differing health outcomes. According to the Robert Wood Johnson Foundation's County Health Rankings report, an estimated 40% of our health condition is influenced by employment, income, and education. Often, our health has more to do with our zip code than our genetic code. If we really want to get to the root of our health issues, we've got to fundamentally change our environments to encourage healthy choices. Which brings us to the role of the business community. It starts with something many businesses know well, making an investment. Getting involved with your community is an economic development strategy. So make an investment in that strategy. Invest in a local nonprofit, many of which are in the room today. If you can, invest in a nonprofit that aligns with your business and your mission. Consider education. Many people don't realize that one of the best ways to make people healthier is to provide them with a better education and job skills. Improving schools and jobs and technical training helps our youth secure better jobs with higher wages and greater economic opportunities. But it's on us to create healthier, more informed workforces to help your company and your community thrive. Another place to make an investment is in your workplace. In 1960, half of all Americans participated in a moderately intensive physical activity as part of their job. Now only 20% of Americans do so, while 80% do less than moderate physical activity. So I challenge you, get involved. Join the Health Means Business campaign to create a business-led culture of health. We look forward to the rest of the afternoon together. It is now my pleasure to introduce Martin Whitaker, CEO of Just Capital. Just Capital is a research organization that seeks to provide all our society's stakeholders, employees, concerned citizens, business leaders, and others, with the information they need to assess how just companies are. By providing the right knowledge and making it easy to access and understand, they believe capital will flow to corporations that are more just, ultimately leading to a balanced business world that takes into account human needs. As CEO, Martin is responsible for the overall leadership of the organization. Previously, he was a founding partner and investment committee member at Sonnen Capital, an impact investing firm, where he led private equity, real asset, and direct investing activities. Please join me in welcoming Martin Whitaker.
Thanks, Louise. Thank you. Good morning, everybody. You actually already heard from two of our board members yesterday, Arianna Huffington and Paul Scialla. I'm working hard on getting Chuck Norris on our board, hopefully by this time next year. We're really happy to be here. Thank you, U.S. Chamber of Commerce Foundation. Thank you to our friends at Robert Wood Johnson Foundation. We're a proud grantee. And really what we're trying to do is create a roadmap for business that is based on the values of the American people. You know, we feel as though the bonds between society and corporations are being really stretched right now. If you look at faith and trust in corporations, it's at an all-time low. Yet business has a massive role to play in solving social, economic, civic, health, environmental challenges. So what we've tried to do at our foundation, the Just Capital, is really, first of all, take the temperature of the American people. We do a huge amount of survey, polling. We do a lot through focus groups around the country to really get a very clear sense of how ordinary Americans, whether rich, poor, East Coast, West Coast, heartland, all ages, all economic backgrounds, what do they define as being the sort of central characteristics of a just corporation? What are your priorities? And we take that as our blueprint, and then we go and develop data and metrics and indexes to measure the performance of actual companies on all those things. And we think by doing that and then providing that information back out into the marketplace, people can buy from companies whose values they align with, they can invest in them, they can go work for them. You know, one of the fastest growing parts of LinkedIn's business, for example, is people searching to work for companies that share their sense of purpose. Now, what does this have to do with creating a culture of health? Turns out, through the last 18 months of our survey work, that many of the things that the public have said they value map extremely well with the sort of elements of creating a culture of health. And we've learned that through our work with Robert Wood Johnson. So we're talking about businesses that pay their people a living wage, that provide good jobs, that have a healthy work-life balance. We heard a lot from people about their sense of economic insecurity and what that means in terms of how the communities that they live in. So providing community support from companies, the products that companies make, how they treat people and the environment throughout their supply chains. So this sort of blueprint, we think, this kind of North Star for how companies should behave is really, we think, going to provide a way to celebrate great corporate performance. Now, so we analyze the top 1,000 publicly traded companies in the country. And of course, we don't just provide all that information out into the world. We have our rankings. We partner with Forbes Media. We were on the cover of Forbes last December to basically identify and celebrate the top companies. We have done a lot of work on living wage, for example, in the retail sector, the 47 biggest companies in the retail sector. Of the 6 million workers who work for those companies, 75 to 80% don't make a living wage in the counties where they work. It's a huge problem. 60 million jobs in this country are at risk from automation over the next 10 years. So whether we know it or not, we've got a very sort of existential challenge, I think, ahead of us in how do we use business and the $15 trillion resources of the private sector to help us solve some of these social challenges. That's really what we're about. And we do that through the power of information. Now, it turns out that the top performing companies in our index, the Just 100, have outperformed the market by, since the financial crisis, about 8%, 3.5% over the last 3 years. Return on invested capital has been 3.5% higher over the last 5 years. And they've created 60% more jobs. They pay 20% of their workforce, more of their workforce, a living wage. They have 17% more women on boards. They recycle 3 times as much waste, and they give twice as much away to charity. And we have many other metrics of business performance like that. So really what Just Capital is about is trying to provide a very clear set of metrics, a path forward. We can showcase what companies are doing. Many of the companies represented in this room, by the way, are among our top performers in the sector. So Humana, with all the programs they do to promote a healthy culture in their workplace. They're also outstanding on paying a living wage and fair pay, actually. Fair pay, by the way, was the #1 issue across the entire country. Whether you were liberal or conservative, no matter what age you were, what income bracket, a fair pay was the #1 thing. And we have 36 other things that I can go into great detail on if you like. But Humana's done a tremendous amount of work in pay and workplace health and wellness. Amex as well was one of our sector leaders. They've done a tremendous job in diversity in particular. And then we have Pepsi and several of the other companies. So that's what we're about. We're not about trying to name and shame. We're about trying to find best practice, showcase that, but do it in a way that's data-driven, that's completely unbiased. We don't take money from companies. We have a team of analysts back in New York that all they do is analyze companies on the things that you, the public, have told us that you care about. So if we make that easy for you to now know, okay, these are the companies that I care about, these are the issues that matter to me, I'm going to go to Just Capital to get the data to figure out what I should do. You know, I'm walking down Fifth Avenue. Do I want to buy a pair of jeans from H&M or from Target or from some other store, and I care about gender diversity? You know, that's where I'm going to go because those guys are the best. And that's how you move markets. So that's all I have for you. I had 7 minutes. I think I've just done 7, so I'm happy to do Q&A as well now as well. Thank you.
Let's give Martin a hand, please.
Thank you.
So we've got some time for questions. If you've got a question, throw up a hand, put it up really high, and we'll get a mic to you. But while we're getting that, while you guys are thinking about your questions, I got a couple questions for you. First, I have an existential question. I'm always intrigued because I hear a lot about companies and their values not being aligned with the values of the American people or the values with any particular group. But companies are made up of people. Companies sell to people. Why do you think values get out of alignment?
I think there's this myth that there's a trade-off. Like, you can't make money and do these things at the same time. And I think that's been perpetuated over the last, 30, 40 years since Milton Friedman said, the business of business is business. We just got to have a maniacal focus on maximizing short-term profit. And a lot of these things that we care about in this room, they are longer-term return generators. But if would you lead your life like that? I mean, Richard, do you lead your life maximizing short-term profit over the next 3 months? I mean, you would never build for the future. You would never invest in your own health. Like, it doesn't make any sense. So we've got to the situation where our chairman is a well-known hedge fund and philanthropist, Paul Tudor Jones. He thinks it's a mania. We have a mania around short-term, in the markets, short-term profit maximization. And when that's your focus, you forget about humanity.
Right.
And so what this is about is trying to sort of, say, there is more. Right. There's a better way to do it. If we really want capitalism to be a force for good, we have to do these things. And you start with information, because if you don't know, the markets don't work well, Yeah. So that's really what I think.
So two other more detailed questions. So you said the thing that people care about, number one was fair pay. What were the other? Can you give me the other four, top five?
Yes, so discrimination, no discrimination in the workplace was well up there. We had real concern over workplace safety, work-life balance. We heard a lot about the products that a company makes. And we've actually done a tremendous amount of work on identifying what people see as being a just product. We heard a lot about worker treatment, so benefits, helping workers prepare for retirement, and the quality of the benefits that are provided. Environmental issues were very important.
And are you asking them to assess from the companies they buy from or the companies they want to go work for, both?
We didn't distinguish. We started with a blank sheet of paper and said, look, what is it that you value in a company's behavior? We didn't tilt the scales by mentioning anything to do with corporate responsibility or anything like that. I mean, frankly, we didn't know what we were going to get.
Right.
Turns out, the American people are smarter than you think. The other thing I'll say is, there was actually a tremendous amount of agreement between left and right politically.
Interesting.
So, that sort of heartened us that actually there are some shared values when it comes to what we really want in our companies, which is really what most of us interact with. And it's unfortunate that we sort of see the country now as being terribly divided, and yet in many ways through our polling we didn't see that at all.
Fascinating. Who's got a question for Martin? We got one right here. If we can, you can maybe just yell it, or this gentleman's bringing it to you. Tell us your name and organization, please.
Good morning. I'm Vicki Verboom. I'm with the National Safety Council. So I was pleased to hear that safety is one of the points that you look at. We have an award that we bestow on CEOs. We call it CEOs Who Get It. And so I think it'd be important to share that with the companies that you work with. But we do find that connection between safety and increased performance and increased productivity. So thank you for the work you're doing.
That's great. And actually that makes a great point. We don't seek to analyze those things. So for example, safety, better than the specialists. So my message to you is we would love to work with you. It's the equivalent of the work we do, for example, on supply chain human rights issues. We're never going to know more than Business and Human Rights Watch. We're never going to know more than Amnesty International, but we want to work with those organizations to take their excellent work, their knowledge, how they analyze companies, and help us sort of measure company performance on those things a better way. So what we're doing now, we're a young organization. Ariana, Deepak, Paul had the idea maybe 2.5 years ago. What we can bring to you is all the polling results. all the analysis of the company behavior, but if you could help us measure that thing, and I'm sure maybe there are other things in the room, better, then we can amplify the work you do and put it in a context of the business case, and take that to the markets.
Beautiful. Other questions? Right here. There's one right here. And again, your name and organization, please.
Hi there, Rachna Govani, co-founder of Food Stand. I run a social enterprise. So my question for you is, as you look at smaller businesses, not the big ones that have the kind of time and resources to implement a purpose-driven methodology, what's your advice to smaller businesses or startups to integrate that stuff from the ground up? And then the second question is, do you think the businesses are leading the charge, or do you think the investment community is leading the charge in terms of supporting businesses that are operating this way?
Boy, that's a whole conference right there. I mean, the small businesses, we focus on the big companies because they employ millions and millions of people and have, vast resources. For sure, just behavior doesn't have to only reside in big companies, of course. We are well aware of many organizations that do focus on small businesses, like B-Lab, for example. I would say that, if we can showcase small business just behavior and take that to the big guys, that's great. We would love to do that. We are developing what we call basically a tool, a self-assessment tool, so that small companies can compare themselves against, what we've heard from the public and what the big guys are doing. So that's that. But I agree with you. I think it's hugely important that small business can take a leadership role there. And business and finance, it's yin-yang, right? So business leaders will say, I want to do more of this, but Wall Street won't let me. Wall Street leaders say, well, if this was material, then we'd be all over it. So we have to connect that. And I think what's broken is that CEOs and business leaders don't feel as though they kind of need cover to do this. They need the sort of, the okay, the thumbs up from their shareholders.
How do we give them
Well,
that
it's already
cover?
starting. So I don't know if you saw Larry Fink. Larry Fink's the chairman and CEO of BlackRock, the world's largest asset manager, wrote to all the companies that they own, which is basically every company, every publicly traded company in the world, and said, look, you got to shift towards, and if you haven't seen that, it's a public letter. I really would encourage you to go find that and read it, because a lot of the elements there are in that letter. I mean, this is the head of the biggest asset manager writing to the CEOs of the biggest companies saying, please do these things. And it's about long-term perspective.
Right.
There's a lot about corporate citizenship and how to look after your workforce. There's some stuff in environment and climate there. So it's happening. I would say that what we need to do is simultaneously make the investment case, which groups like SASB, for example, Sustainable Accounting Standards Board, they're doing that. But we also need to sort of identify and amplify the situations like the ones I talked about, where companies that have done these things have actually outperformed the market.
So bring it home for me. Give me one tip for a business, somebody who's here in the room who's not a CEO, who's maybe a middle manager. What can they go and do? If I'm with an NGO or a government, what should I go and do?
Well, I think I would like to see more connectivity between companies. So the networking around, because everybody's got their own plan, and that's part of the problem.
Right.
Is if we could sort of aggregate that thinking a little way. So this is going to sound really self-serving, but if anybody would like to reach out, we're happy to make the polling results available to anybody. So if there are any managers in the room who would say, I want to know what America thinks, and maybe even the different stakeholder cuts, maybe millennials, what do they prioritize? And I'll just provide those results to you, and then you can use those in your business to say, hey, look, people care about this stuff.
Okay. So download your results. They can come to you. You'll help them out.
Yeah, no problem.
Big hand for Martin Whitaker, please.
Thank you.
Thanks so much.
Thank you.
Up next, we've got some really important and valuable research. We're going to get an update on the Health Means Business research program with our partner from the Hudson Institute. This new research builds on lessons we've learned throughout our 2-year campaign. It really looks into why it makes good business sense for businesses to invest in community health. And today we're going to be joined by the Chamber Foundation's Director of Research, Dr. Lawrence Bowdish, and Hank Cardello, the Director of Obesity Solutions Initiatives at the Hudson Institute. The research they're going to share today is going to add to the evidence that there is an inverse relationship between socioeconomic status and obesity rates. And I think it's really going to be a great opportunity for you to really kind of delve in and ask some pointed questions about the business case, because this is where I think the business case is going to come out. So we're going to hope that you'll ask these guys a lot of tough questions. Help me to welcome Lawrence and Hank, please.
How you doing? Good morning, everybody. Thank you, Richard, for that introduction. As he suggested, one of the components of this Health Means Business campaign that we were lucky enough to partner with the Robert Wood Johnson Foundation on was to produce some research that helps sort of make the quantitative evidence for the business case that businesses should get involved in their community health programs. And so to accomplish that, we were also lucky enough to partner with Hank Cardello here. He's with the Hudson Institute, where he is the director, I love this title, of Obesity Solutions, everything that includes. But he also has considerable experience in the corporate sector. He was a corporate executive for Coca-Cola. And his newest book is Stuffed, where he actually discusses the broader connection between community health, public health, and how corporations interact with it. And so I'm really thrilled to have Hank sort of walk us through some of the research that that he's found, that he and his team have found, and how it relates to a lot of things that we've seen here today. So Hank, go ahead.
All right, good morning, everybody. It's very nice to be back here. Thank you for sharing my blasphemy with me for the next 15 minutes or so. But I was intrigued by what Martin had to say, because over 6 years ago, we forged a very early partnership with the Robert Wood Johnson Foundation. And for them at the time, it was a big stretch to be actually looking hard at, wait a minute, how do we start moving towards a business aspect to the kinds of work we're doing to try to reduce childhood obesity and make America's children healthier. And this has been a long journey, and quite frankly, it's very heartening to me to see the kind of progress that has been made here. And what I want to do this morning is give you a peek under the tent on some new work that we're doing that complements some of our previous work. And we'll see, there we go. Oh, I went too far. All right, there we go. I think everyone knows that obesity is a problem. We use obesity as a proxy for general health, even though we've looked at other metrics. But it's very clear that when you have 4 states with obesity rates over 35%, and only 4 states plus DC under 25%, Houston, we have a problem. And it continues and it perpetuates. And the key is it does impact not only the individual's health, but also the health of communities. And as we'll see, there are opportunities to engage industry and corporations and small businesses in this to try to turn it around. It's all really interconnected. We're kind of at the confluence where it's not an either-or proposition anymore to be advancing healthier, let's say, actions or activities on the company's side because they're worried about it may hurt their business. Right now, everything's coming together, so it's in their best interest to be doing this. So just to give you an inkling of what we've been doing, we've performed a series of studies with Robert Wood Johnson, the Healthy Weight Commitment Foundation, which is a grouping of food industry CEOs, to look at, well, what's the impact of selling healthier products, lower calorie products, smaller portions. And it was very clear that the growth that these companies were experiencing literally came out of those better-for-you products. In the case of Healthy Weight Commitment Foundation, 99% of the growth they experienced over a 5-year period came from these kinds of products. In other words, the old iconic, let's say, less healthy, highly caloric types of products weren't carrying the load anymore. They couldn't rely on these products. And this is a difficult message to receive, because you're talking about your baby. They just called your baby ugly. So this is tough to make that kind of change. So you've seen the brakes starting to come on, but it's not an immediate, I get it. We find many companies, of course, have aligned their philosophies and strategies along what Martin said, but there's still many out there that are still struggling to make that transition. And I think that's an important word. We talk about transitioning companies and businesses to change, whether it's the products they sell or the practices they employ, because it's very, very difficult to go from 0 to 100, to change what we're doing now to automatically shifting over to something different. So what we want to share with you today is tell you about a study we've conducted in concert with the U.S. Chamber of Commerce Foundation. And first of all is to determine, is there a real quantitative link between, let's say, the health of populations and economic metrics? All right, that's number one. But even more importantly, what actions can be taken by local businesses and chambers of commerce and communities and businesses to make a difference here? Because ultimately, as Lawrence emphasized, we focus on solutions. We are agnostic whether who benefits from them or not. We actually believe everyone needs to benefit for things to be effective. So that's the intent that we bring to this. And I won't belabor the methodology, but just to show you, we looked at a whole host of economic data as part of this, whether it's per capita GDP, income levels, employees on payrolls. And we also looked at other health and obesity data, not only obesity rates for adults and population, smoking rates, and other health metrics. And we looked at these on a county level, because most of our work has been done on a macro level, looking at overarching sales that these companies have, looking at hundreds of thousands of products that are being sold. Well, this is kind of a flip for us, looking at it from the ground up, looking at 1,500 or so counties and getting a sense for what the best and the worst, for instance, counties look like. Are there any links there? And more importantly, as we'll get to later, we always like to look at trend data. Are things changing over time? Is there really something here that links together over a time period, or is it just a one-shot deal? And then complementing that, we did take a look at state level, again, top 10 state, bottom 10 state, to see what the differences are. Are there really differences? We have a lot of anecdotal evidence, but let's really find out what really happened. So looking at the county level findings, it's very clear, just singling out obesity, because it's a pretty good marker for overall health metrics, that looking at that versus median income, it was very clear that there were huge differences here. So if you look at your top most obese counties versus the bottom, let's say the least obese counties, it's very clear that the most obese counties, guess what? You're over 40% obesity rate. That's not obesity and overweight. That's obesity compared to those that were the healthiest, where obesity rates were under 20. And if you recall from that first map of the U.S., not one single state any longer was under 20% obesity. So you see that the obesity rates are almost 2.5 times in these, worse obesity states. And it also translates to income. All right, you're seeing that the income is half in these states that exhibit the highest rates of obesity. Now, this isn't causal, all right, so we're not going there, but what's very important to understand is that, especially from a business standpoint, if you have an unhealthy population and they have half the income on average, very difficult to be vibrant in these kinds of environments. And then just to go to looking at the 100, just to see, well, is 50 too small a sample? Well, it kind of looks the same. You have the same kind of phenomena where the most obese counties are clearly suffering from significantly less income. And this has major ramifications for companies. It's not only the companies and the small businesses that are there, because their constituencies don't have the income to be able to support these businesses. But also when you flip it, how about attracting new businesses to these areas? And when you say, well, this is a group that doesn't have the wherewithal to support a strong business community. So now you have the yin and yang attached to this. And then we said, well, okay, let's check on a state level. State's a little bit more difficult in the sense that it's easier to analyze. That's the good news. The bad news is there's lots of factors in there, lots of other things going on. And again, it pretty much, when we looked at average per capita GDP and median income, you see the same kind of pattern here with the top 10 most obese states and the least obese states. Same kind of thing. The GDP per capita measure is at 3/4 of the low obesity states, and again, the same kind of pattern with income. So again, it's playing out not only on a county level, but also on a state level. And of course, we've looked at the data on a national level and in some international places, and the trend just holds. So the message that has been bandied around here is very accurate, and that is there's such a tight link now that you can't ignore this anymore. Now, what I want to do now is, to me, this is the most important aspect of what I wish to talk about today, because we looked at 10-year period from 2004 to 2013 to see changes. What changes in obesity rates, changes in income, and other economic metrics. And obesity went up almost 6 percentage points over this period. So when we say counties with below average obesity increases, we mean counties that either went up just a little bit or actually declined in their obesity. So they're the better counties, just to use that terminology. And you also must recall that this was also the period that captured data coming out of the recession. And what we saw that when you compare the median income declines, which overall was about 1.7% during this period, those that had less increases in obesity rates actually performed better compared to those where they continued on a bad trajectory in higher increases in obesity rates, and they saw almost double the decline in net income. So this is a very telling chart here that the economy is strongly linked to obesity rates. We also looked at payroll per establishment is another metric. It gives an indication of how healthy companies are and how well their hiring practices are and how many employees they're adding. And again, you see something very similar in those counties where the obesity rate kind of held steady, declined, or just went up a little bit. They had a much larger growth in payrolls than we saw in those counties where the obesity rates were growing at a much higher level. And then just a final piece of information looking at employees per establishment. In other words, where are the big employers? Where's the ability to support employment in a community? Again, the exact same trend where you're seeing that those counties that are, quote, healthier here actually show a better economic metric than those which are less healthy. So there's definitely a pattern here. Again, we don't get into causation because the data doesn't quite give you that insight. But what it does say, looking at all the work we've done and all this work on top of it, there's a consistent theme running through all of it. And that we're at this juncture now, again, as Martin indicated, it's not either or. It's not companies need to just focus on their profits and totally ignore communities or employee health, et cetera. It's in their best interest to do so. So what we'd like to do right now very quickly is we're going to give 3 examples, and Lawrence will take you through those, about some of the counties and how this data is playing out in specific counties.
Thank you, Hank. So one of the things I did when I wore a younger man's clothes, I taught economics and climametrics at Ohio State. And so as I look at the audience, as Hank is giving this sort of great overall view of the data, I see about 2/3 of you with cameras out, really paying attention. I see 1/3 of you going like, oh, okay, what do these bar charts mean? And so what I'd like to do is sort of illustrate some of that. Like, I'm not Pablo Picasso, I'm not even Justin Timberlake, but I do want to sort of paint a picture of what this looks like. And so the first county I want to look at is, since I had the ability to sort of sit in the back of the room of a lot of these meetings we went to, is Cuyahoga County, Cleveland. And what I want to do is sort of show, anyone from Cleveland here? I saw some people sort of, there we go. My wife is from Cleveland. I've been there a lot. It's a great place. Her parents are trying to get us to move there, so if you've got a job for me, I'd love to hear from you. So Cuyahoga County in 2013 had 1.2 million people in it, a decrease of 5.8%. They've been losing people for about 25, 30 years. In 2004, the obesity rate was 26.4. In 2013, it was 30 point even. That's an increase of 3.6, much lower than the national average per county in increase in obesity. Even though Cuyahoga County lost 4,200 establishments, this is what the Census Bureau talks about individual stores, it increased its employee per establishment by 9% and its payroll per establishment by 10%. So the places that remain are healthier, they're larger. Another place I want to look at, and this is my heart, this is my home, Bay County, Florida, where I grew up, Panama City, spring break. Had 175,000 people in it in 2013, an increase in 9.7%. Now I hope for purposes of illustration, you will allow me to sort of consider 29.9% and 30% obesity to be close enough to consider roughly the same. Please indulge me in that. And however, Panama City, Bay County showed an increase of 8 points in its obesity, 2.5 times more increase than Cuyahoga County. And look at the employee and payroll numbers, much lower. Employees per establishment grew less, payroll grew a lot less. Now, part of this is even thinking about what was happening in the recession, which hit the upper Midwest much harder than hit the South. So even with that, we're seeing this connection here. Another county I do want to talk about, it is Black Hawk County in Iowa, Waterloo, where University of Northern Iowa is. The only reason you probably know about that, unless you went there, is if they make the they make the 64 tournament every couple of years. 132,000 people in Black Hawk County, an increase of 4.5% in population, so Black Hawk County is growing. Again, essentially the same increase in obesity rates as Bay County and Cuyahoga County, but an even less of an increase, very small increase in obesity for Black Hawk County. Employee and payroll numbers, a little higher than Cuyahoga. Now, one of the things I do want to point out here is that I'm sure someone in here could suggest, well, Lawrence, you're cherry picking examples. I mean, of course, you can make there are 3,100 counties in the US. I can pick any 3 counties I want and make it say whatever I want. But one of the things I want to point out here is that one of the things that separates Cuyahoga and Black Hawk, both pretty good performers, from Bay County, is that Cuyahoga and Black Hawk County, if you look at their top 10 employers, they're the private sector. Cuyahoga County has got 3 major medical facilities. Nestle is adding 300 jobs to right outside Cuyahoga County. Lincoln Electric, one of the biggest engineering electric firms in the country, is based in Cuyahoga County. Black Hawk's the same way. Black Hawk has John Deere, Tyson plant, a couple major medical facilities. Bay County, the top 10 employers, only 2 of them are not the military or the government. One of them is Eastern Shipbuilding, where my brother works. And the other one is, number 10 is Walmart, is the biggest employer in the county. Which shows another illustration that places where businesses are, the private sector has a better opportunity to push forward issues of community health because they can impact employees more quickly, they can hit a bigger share of the population. So I just wanted to illustrate some of these examples, and I'll let Hank sort of give the better conclusions of the broader data.
All right, thank you, Lawrence.
Thanks.
Bring that to life, which is very good. All right, so let's recap what we're talking about this morning. The linkage is there. All right, I think we belabored that, but it's real, it's quantitative, it's on a macro level, it does show up on an individual county level and a state level. So again, it's real, it's not fabrication any longer. There also seems to be a huge upside for collaboration now involving chambers of commerce and business and local municipalities. If you look at the benefit for communities to do this, it's clear that they can benefit from having healthier populations and all that accrues to it. And it also, and I'll give you an example momentarily, where they can now attract businesses, which is a big deal. It's an economic engine for them. So they definitely could benefit. Companies, again, we've seen it time and time again. It's not only the health of the workforce. A healthier workforce, it's been proven quantitatively to help with reduced levels of absenteeism, what they call presenteeism, illness, costs of health care, et cetera. So it's on the cost side, but what we've also determined is on the revenue side, that healthier populations also benefit from that. And then finally, from the business community and the chamber together, you can pull everyone together. An example would be Nashville. They have Nash Vitality. And this is a program where they were looking to attract businesses, and then the municipality and the businesses there are very big on hospital industry. Vanderbilt University is there. They all pulled together. They're giving away free bikes. There's pilot programs to improve diabetes care, which is reducing healthcare costs. You have more greenways in that town. And again, this is something that's showing to be very tangible and improving their image. So going forward, I'll just go through this quickly because we're over time. And that is, these study findings are conclusive, but I think there's a huge opportunity to dive in and find out causation. Lawrence gave very specifics on 3 counties. Well, what does it look like when we look at the top counties versus the lowest counties? What's working? What corporate programs are having more impact? What chamber programs are having impact? What environmental programs are having more impact versus those areas that don't have it? And I think this is something that is wide open for us to look at so we can take that next final step. And if I just have a message to leave for the public health and the nonprofit community, and that this ties in again a little bit to what Martin was saying, focus on corporate metrics if you wish to motivate companies and small businesses to change, as opposed to, let's say, simply the public health side. Everyone in every corporation does care about this, but what motivates them are the metrics. And my message to the business community is act in your own enlightened self-interest. This works. This will work for your bottom lines. It'll work for your top lines. And with that, thank you. Appreciate your time.
Thank you.
Thanks, Lawrence and Hank. You guys aren't going anywhere. They'll be around to take questions later. Is that right? Easy questions to me, hard questions to Hank. Okay, you heard that. Easy questions to Hank, hard questions to Lawrence. No, okay, the other way around. I was also shocked to learn, Lawrence, that you're not Pablo Picasso or Justin Timberlake. Thank you for the update. That was really great research, guys, and thank you for sharing that with us. It's now my pleasure to introduce Cheryl Odom. Cheryl, you wear 2 really important hats here for us. You're the Vice President for Education Policy here at the U.S. Chamber of Commerce. You're also the Senior Vice President for the Center for Education and Workforce at the U.S. Chamber of Commerce Foundation. You were so kind to join us for our regional forum in Fort Worth. You've just been a terrific advocate for creating the healthy and vibrant workforce that America needs in the 21st century. Ladies and gentlemen, help me to welcome Cheryl Odom.
I feel like I'm going on a game show or something. Thanks, Richard. Thank you so much for the kind introduction. Before I get to my real job here, I just want to say a couple sentences about the work that we do. Really about opportunity, right? It's at the heart of the American dream, and at the heart of opportunity is a job. And when the right person fills the right job, communities are healthier. Families, neighborhoods, businesses, we all grow and prosper. Yet we all know there's a troubling and challenging disconnect in our country, a gap. We have people without jobs and jobs without people, and it's a challenge not only in the workplace, but it really has roots in the classroom. And in this increasingly global, hyper-competitive environment, we're all challenged with preparing the students of today for the jobs of tomorrow. And we have real struggles all across this country where your zip code often determines whether opportunity exists for you. We all know these statistics. We talk about them all the time, hovering somewhere between 30 and 40% of our young people are reading and doing math on grade level. And if you look at those statistics for low-income, disadvantaged minority populations, they drop to somewhere in the high teens. What opportunity really exists for a young person who goes on to try to pursue additional education or a job when they get out of high school if we're not doing our job at that level? And so that's really what we focus on at the Foundation Center for Education and Workforce. We're about closing that people-jobs gap. We pursue solutions in the workplace, in the community, in the classroom, so that Americans have the skills for the jobs of today and tomorrow, and the American economy has the workforce needed to grow, and communities are healthier as a result. And so I'm so grateful for this initiative and my colleagues at CCC and the support of the Robert Wood Johnson Foundation to really spotlight the importance of education to a healthy community. And honored, really honored to be with you here this morning to have the opportunity to introduce Dr. Valerie Montgomery Rice, the President and Dean of Morehouse School of Medicine. Dr. Montgomery Rice, an OBGYN and recognized infertility specialist and researcher, provides a valuable combination of experience at the highest level of patient care and medical research, as well as organizational management and public health policy. Marrying her management skills and strategic thinking to tackle challenging problems, she has a track record of redesigning complex organizations' management infrastructures to reflect the needs of evolving strategic environments and position the organization for success. She was recently elected to the National Academy of Medicine and presented with a Lifetime Achievement Award from the Horatio Alger Association. Both of these accolades reflect her lifetime commitment to education, service, and the advancement of health equity. So please join me in welcoming the President and Dean of Morehouse School of Medicine and the first woman to lead the freestanding medical institution, Dr. Valerie Montgomery Rice.
Thank you for that wonderful introduction, and I am so happy to be back speaking to the audience here who really cares about how we build bridges between community, health, economics, and education. And so I'm going to share with you, I think I'm sandwiched between people who talk about community health, and then we're going to talk about partnerships. And I'm going to focus some on education, but first I'm going to take you through a walk to really think about what health equity means. And as you think about health equity, I really want people to focus on these definitions that, 2020, all of these commissions we come up with, they come up with these complicated definitions. So this was the 2021 attainment of the highest level of health for all people, da-da-da-da-da-da. But what I think about is health equity does not mean giving everybody the same thing. And I just remind people of the simple cartoon. It's a simple cartoon. And if you think about or use the analogy that the people looking over the fence to see the game, the purpose of going to the game was to be able to see the game. Nobody wanted to stand behind the fence, and they all came there with different attributes, right? One person was short, one person was tall, one person was medium height, and they were late. They only had $5, they had to stand behind the fence. Tall friend said, I'm going to go and get us a box so that we can look over the fence to see the game, because the object was what? To see the game. He came back with 3 boxes, gave everybody the same size box. Short person still couldn't see over the fence. Medium height person could see, and the tall person now, who gave himself a box, rightfully so, that's what equality is, giving people the same thing, even if they don't need it. He was then blocking other people who were late. But what if he had given the short friend 2 boxes, the medium height friend 1, and then didn't take a box at all that day, because the object was what? To see the game. Be able to see over the fence. And that's what health equity is. It's about giving people what they need, when they need it, and the amount they need to reach their optimal level of health. Now, for all of you all who are in business and who are in the chamber and all, it does mean that you are going to have to reallocate resources. And therefore, you're going to have to make hard choices. So I'm not saying that any of this is easy. But if we look at just Georgia, and this is my wonderful state of Georgia, that we have 159 counties in our Georgia, and 119 of them are probably underserved, meaning that they don't have enough healthcare professionals to take care of the population. We at Morehouse School of Medicine about 7 years ago did this health report card, and we found significant black-white racial inequalities in health outcomes. And if we just looked at Fulton County, where Atlanta is, multiple institutions of higher education, you can see that there were 28,000 excess years of potential life lost due to those premature deaths. And if we look at all of the things that we measured in this assessment, we saw that we had some real problems throughout the state of Georgia. Now, does it make a difference in resources? Of course. If you have a limited amount of resources, you don't want to utilize those resources irresponsibly. And irresponsibly meaning that you know that these differences exist, but you aren't brave enough to reallocate resources to prevent the inequities. And so when we just looked at hospital admissions, or whether we looked at hospital charges or payer costs, we can see that this contributed to excess payer costs due to just those racial variations in outcomes. We also looked at ED visit rates for uncontrolled hypertension and the racial disparities that looked at the rural-urban differences. And again, you can see those differences, but the racial disparities continue to persist. And again, we saw the same thing with mental health visits when we looked at rural versus urban. And part of that is secondary to access. So when we hear that 5 rural hospitals in the state of Georgia are shutting down or closing, we know that that is going to add to the inequities that we're going to see and the challenges that we're going to see as it relates to health. If we look at Grady Hospital, and this is a study that we did in conjunction with them, we looked at what's the visit to Grady, and you can see that emergency or not preventable versus non-emergencies, at a minimum, all of the ED visits could have been safely and effectively treated outside of the ED. Again, an access issue. Now, what about uninsured hospital admissions? We know that we're going to have a lot of discussions around the Affordable Care Act, or whether it's going to be repealed or repented or whatever's going to happen with it. But what we know that when you have uninsured persons who do not have consistent care and access, that it ends up, regardless of which way you want to slice it, costing more dollars. And again, when we have a limited resource pool and we're trying to reallocate resources to people when they need it and the amount they need for them to reach their optimal level of health, are we responsibly utilizing dollars? Morehouse School of Medicine is primarily focused on primary care, and so we really do believe in prevention. We believe that an ounce of prevention is better than a pound of cure, that if we can prevent disease, it makes a big difference. So we've delved into many times, what are these strategies that we should have for community well-being? And we know that primary care matters. So let's talk about the solutions to some of those challenges that I've put forth. First of all, preventive services really do matter. Aspirin, smoking, colorectal cancer screening, flu shots, breast cancer screening, all of those things have been shown in multiple studies to save lives. So these things, when you talk about what can you do in partnership and collaboration, the educational messages, imagine if we had educational messages or commercials on television about this as much as we have when a product is being advertised and they start that long and you have to worry about these, and you don't know what they're saying anyway. What if we had those same type of messaging on a regular basis, such that people understood the things that they could control in their life to make a difference? We also know that many things can be impacted about if we have coordinated care. And so we've been looking at the role of the presence of community health centers and how they serve as an extension and a prevention to what happens when someone has what they assume is an emergency. It may be urgent, but not an emergency. What if they had that intermediate place, like a federally qualified health clinic or a community health center or an urgent care center to engage in? Again, partnerships that we sometimes have to stand up with the resources from multiple sources. Now, most of us know that by the time you get to the doctor and have the cardiac cath, that's kind of too late. You've already decreased your chances of successful outcome for long term in a way that really perhaps could have been prevented. Medical care only accounts for about 10% of health status. Most of it is behavior patterns, social circumstances, environmental exposure, and genetic predisposition. We also know that we have to triangulate on success. Every discovery, every intervention, let's say for understanding the connection between smoking and lung cancer, and how if you do not smoke, you decrease your chances of developing lung cancer, etc. Yes, a lot of that occurred in the lab, but the understanding of that occurred in clinical trials, and then the prevention part of it had to be a public health and health promotion. We had to deliver the right care to people who had been exposed. But when we started thinking about what do we want for our children, we started having all types of campaigns where your child would, in the second grade, would come home and essentially they would see you with a cigarette and they would snatch it out of your hand because of something they had learned in school. Think about what we've done with car seats. It's a triangulation, you all. Research, public health and promotion, and primary care. So all of these things that we have made a difference in this country have been because we have triangulated. So partnerships are very, very important. Those partnerships look like a lot of different things. And I am so excited about the fact that corporations and businesses now understand that they have to be a part of this, because most of us spend our time in our workplace. So what we learn there, how we engage, how we extend our resources from our businesses out into the community really makes a difference. I put this here to say that access alone, though, is not enough. And so when I think about what happens with education, we began to see, and this is some Kaiser data that came out in 2011 from their survey, where their members who now all have access to care, okay? But look what happens when you think about the self-report of whether my health care is excellent or good. People who have less than a high school education, you can see what they rate here, age 25 to 24, high school graduate, some college, and college. Clearly, the more education you have, I believe the more empowered you feel. It clearly ties to your economics, and it also ties to your ability to make choices about what you will engage in, what opportunities, say, for screening that you will capitalize on. We know that poverty, education, and health go hand in hand. And you can look at multiple surveys. You could pull the data that he just presented on obesity. And again, you will see higher obesity rates in more poverty-stricken areas. And people say, why is that? Well, part of it is not that people don't get any food when they are poor, but they don't have access to the right foods that lead to the opportunity for them to be healthy. Now, what about earnings? You all are seeing this, and you know that Look, if you were to flip this, I always think about this, if you were to mirror this, it mirrors. When you look at unemployment rate, when you look at earnings and employment rates by educational standards, we know that persons who have less education will earn less. And if that is a factor that leads to a challenge in a secondary to education, it clearly impacts health. I am a reproductive endocrinologist and fertility specialist, and so I've done, 1,000 in vitro fertilization procedures. I think we should start reading to them right then, because I believe that that is one of the factors. It clearly shows that babies begin to absorb language in utero at 30 weeks. And the fact of having a 500-book library or a university-educated parent propels a child 3.2 years further in education. Letter recognition, cognitive ability, enhanced vocabulary. Think about what it means that for our generation of kids who really have grown up in front of a computer. Think about the advancements that they will now have for critical thinking and decision making. We spend a lot of time at Morehouse School of Medicine thinking about this because we've adopted a school, a K-5 school. And the reason we adopted this school was because we understood that a child who can't read by grade level 3, by third grade, is 4 times less likely to graduate by age 19 than a child who reads proficiently. And if you add poverty, you add 13 times. And so, if we know all of this, if we know that education matters, if we know the connection of the social determinants that impact health, if we know that poor health put education at risk, we know that there's some causality, what are the things that we need to be doing? How do we look for that high earning potential? How do we look for this return on investment? And this is where you come in. We have to invest in our community. We have to invest in our community. We have to create opportunities for activity. We have to create opportunities for learning about healthy foods. We have to understand the role that sports and team play matter. We have to participate and donate to the library. And it has to be a part of your mission. And that's what we've done at Morehouse School of Medicine. We have made it a part of our mission to understand that if we're going to lead the creation and advancement of health equity, we can't just do it within the confines of this higher ed community that we live in. When we look at recruitment of our students, we know that 119 of the 159 counties in Georgia are underserved. So we track every applicant that comes from an underserved community. We track everybody who gets an interview. We track everybody who gets in. And where there are the green and the yellow, we know that those are opportunities for us to work with our alumni and other groups who are interested in ensuring that we select students from those counties, because we know that the highest chance of someone coming back and practicing in an underserved community is that they're from that community. We also have multiple pipeline programs that feed into one another. They have milestones, and they detect for us where there's a gap and an opportunity for a child. And so we have adopted Tuskegee Airmen Global Academy, and we have now 120 of our employees who are certified mentors who are in that school every day. And next 3 months, we're focusing on reading. So that's all we're doing is reading with these kids. We built them a STEAM lab. We have quarterly activities. Last week, we had 600 kids on campus, and we do that once a quarter. And then we also worry about these social determinants, and this is very important. This is a program, the Carrera program, that we had a grant for 5 years ago, where we took kids between the ages of 10 and 14, 5 counties, and we looked at these factors. And the whole goal was 0% teen pregnancy rate by exposing them to the opportunities of what was possible. We did education, we did workforce development, we did a multitude of things. And guess what? 5 years, 180 kids, nobody pregnant, male or female, okay? Why do we invest so early? Part of it's selfish. We need a pipeline. We need a pipeline of people who are ready. But we also know empowered generations equates to healthier generations. And we know that we will never achieve equity unless we address the social determinants. So it's all really about workforce development. And of course, we are always thinking about our past and looking toward our future and understanding that whatever affects one directly affects all indirectly. And that I, you, none of us will ever be what we ought to be until you are who you ought to be. And that's interrelated. So thank you very much.
Thank you so much, Dr. Montgomery Rice. So if I was to highlight, to me, the 5 big takeaways there, number 1, poverty, education, and health go hand in hand. Number 2, we got to start young. And when we start young and we have well-prepared students, that results in well-prepared workers in our workforce. And the big key here is prevention and promotion.
Prevention and promotion. What we have to do is figure out how to empower people to make great choices. And so if you have the only choice to be one of the good choices, you already self-empower people.
So give me one thing that you think businesses can do to help with prevention and promotion at work.
I think having opportunities where, and it starts with the leadership, where you endorse and lead by example, exercise and behaviors that reflect that you understand the connection between prevention and wellness. So everybody and who works with me knows that I work out 3 days a week. I talk about it. I'm willing for people to come in 30 minutes late if it means for them that they're going to be working out. Because I believe that you have to set that as an example. We talk about it. What we have in our cafeteria. We now are starting to put the calories in the cafeteria of everything that we offer, so that people are beginning to make more conscious decisions about what they eat. And so I think you have to lead by example, and you have to put forth a culture that expects for people to take care of themselves.
So lead by example, create a culture that prioritizes people taking care of themselves, and put data in their hands so they can make better decisions.
Exactly.
Ladies and gentlemen, Dr. Montgomery Rice.
Thank you.
Thank you so much. Okay, folks, we had our first Power of Partnership session yesterday afternoon. Today we have our second Power of Partnerships session. This is an amazing partnership we're going to hear about today. Let's go to the video screen.
When Dan and Tanya Snyder started the Redskins Charitable Foundation in 2000, they had one goal in mind: using the Redskins brand to inspire and support young people in our community. They're proud of the work the team does to help children achieve their dreams and believe that doing good leads to greatness.
I feel like windows roll down new city streets and cabs. I feel like anything can happen, laughing. You take me right back when we were kids. Never thought I'd feel like this. Like when I close my eyes and don't even care if anyone sees me dancing. Like I can fly and don't even think of touching the ground. Like a heartbeat skip, like an open page, like a one-way trip on an aeroplane. It's the way that I feel when I'm with you. Brand new.
I just feel the need to give back. You know, I feel like in my life, I've been given so much, and so many people helped me to get to the point where I am today. And I feel like I have to pay that forward, you know, and to help kids, especially, and to have an impact in their lives, so to make them go down the right road instead of maybe another road that they shouldn't. It really, that's what drives me to do this stuff. And so if I can impact a kid's life, just one, that makes me.
Our next panel is going to be filled with people who are going to be familiar to anybody who is a football fan in today's audience. We're thrilled to be joined by 3 members of the Washington Redskins team to learn about the NFL Play 60 initiatives. Joining us today are Larry Michael, the voice of the Washington Redskins, Will Compton, inside linebacker for the Redskins, and Tony Wiley, the senior vice president for the Redskins. Please join me in welcoming Larry, Will, and Tony.
Thank you, Richard. Thank you so much on behalf of everyone with the Redskins organization. It's our honor and privilege to have been invited here to the U.S. Chamber, across the street from the White House, to give this presentation. Thank you again for inviting us. And we'll step to it. This gentleman over to the right has had a heck of a long career in the National Football League, and we're so happy that he's been with us over the last few years. He's our Senior VP of Public Relations and Communications, Mr. Tony Wiley. And it's great to have one of our players here, number 51, Will Compton. He is our defensive signal caller. He calls the signals on defense for the Redskins each Sunday. He's right in the middle of all the action, all the violence, all the hitting. And he recently was voted one of the top 5 best-looking men in the NFL. Will Compton, ladies and gentlemen. I promised Will I would get that in there as we start this presentation. So who here has heard of what Play 60 is? Play 60 is a program that the NFL kicked off a few years ago. And Tony, you've been, I don't want to say how long you've been associated with the NFL, but basic description of what Play 60 is and what it's all about.
Sure. Childhood obesity is an issue in this country. So the NFL uses the Play 60 platform to encourage kids to exercise 60 minutes a day to get active, whether it's just whatever. Just basically just get up and moving for 60 minutes every day in order to be active and be healthy.
And Will, as a pro football player, I know that was always your dream to get to the pros, and you're very successful now. What special obligation, responsibility do you think the league has, and for you and your teammates, what are your obligations giving back in this regard for a Play 60 type of program?
I think we have a huge responsibility, not necessarily as a football player, but as people of influence. I look back and think about how I was as a kid and how much people of certain statuses influenced me, and how much, I wanted to listen to people or work out and do things of that nature. So you always get sold on what people do, and I think what I do gets your foot in the door for kids and get in front of kids. But as you're at these events and doing all these physical activities with them and things of that nature, I think we have more of an obligation to start having kids think about why they're doing things and what decisions they're making, beside just being out on a field doing a Play 60 event. So, we sell what we do. It gets us in the door, and then I think we have an obligation as football players now, the NFL now, is to help them start to explore, why they do things and what choices they make, good and bad, away from the field.
Where'd you grow up?
I grew up in a small town called Bonne Terre, Missouri, south of St. Louis.
Did you have programs like this growing up? Was this something that was missing? And thinking back, if you could have had a program like that, how would it have helped your friends and the kids at that time?
Yeah, no, we didn't really have programs like that. I think, I would go to like Rams football camps as a kid, and you would just be in awe being around these guys. But the thing that I always took away from, because you always wanted to do the little celebration dances on weekends and do what they do all the time, but once you got around them and they started to make you're interacting with them and everything else, they started to allow you to dream and think about what you wanted to do when you get older, obviously being like them and things of that nature. So that's why I feel like we have a responsibility not only to just be a football player in front of them, but help them understand what they want to do, what decisions they're making, like in school, around their family, around their friends and everything like that, and keeping good peer groups and things of that nature.
Yeah, I saw the video, and we happen to work for a very philanthropic ownership for the Redskins, very active in the community. And Tony, Play 60 is the national program, but you've got the Salute to Play 60 that the Redskins started several years ago. Could you talk about that a little bit and what makes that special?
It's very special because what we do is every preseason, the whole entire team will hold a practice. And we're one of the only teams in the NFL to practice on a military base. So we'll have it right there at Andrews Joint Base, and the players will practice and right afterwards sign autographs, but they also encourage the kids to be active. They have like obstacle courses, they throw the football, they jump rope, et cetera, but we actually engage with the fans right there at the military base.
Well, do kids look, I mean, obviously kids look up to pro football players. How often do you experience that? And you do charitable work yourself and you're active in the community. How often and what does it feel like to you when you know that when a child meets you that they'll remember that the rest of their lives?
Yeah, I mean, it's incredible. I mean, we get to do a lot of work with the Redskins, you know, wear our jerseys, be around the kids, interact and engage with them. So that's always a lot of fun. And then when I'm back home, I have my own football camp back home for all the kids there. And it's just awesome, man, because you know how it was being a kid. You know, I go back to my schools all the time and you see the same lockers, the same hallways that you walked, and you just try to express to them that you came from the exact same area in the same place. And it's about believing and achieving and going after all those goals and dreams, and it's a very surreal experience still.
Will and I have one thing in common. The Redskins are the only team we've ever worked for in professional football.
Fortunately.
I have a different background. Tony, however, has been a public relations director at the highest level. He's worked the Super Bowls for a variety of NFL teams. And not to sit here and brag on us, but the Redskins Foundation, which is really at the heart of why we're here, what makes that foundation special?
The impacting thousands of kids. I mean, we're all about health and wellness, and not only that, Larry, but the partnerships that we form with the foundation, with the National Dairy Association, USAA, the types of partnerships that we partner with to increase the platform and get the kids engaged is something that's very special. Very few teams make the impact that we make in this community.
And on a local level, last year we kicked off a program with the DC Public Schools called FIT, F-I-T-T. And Tony, what is that about? It just kicked off. I don't know if anybody here has heard about it. It's with DC Public Schools. Could you tell us about that?
29 schools in the area, well over 2,500 seventh graders are impacted by this program. What does FIT stand for? It's an acronym: frequency, intensity, time, and type. That's what it stands for. So what kids do, they said like the Educate Empowering 7th grade students, we partner with the American Diabetes Association and the DC Public Schools. So what they do is they have a program, a 40-page book, and they get to write their own fitness program, and they get a grade for it. So we encourage all the kids to be active, and the kids that get A's are going to be celebrated in May at FedEx Field. We're going to have a big, huge recess day. So it's pretty cool to not only get active, but to get an A in it. And you set your own curriculum, whether it's playing Pokemon Go or walking the dog, jump roping. You set your own program. That's right. You set your own program, and you get an A for it. So it's pretty cool.
You should have heard him practicing what FIT meant in the car on the way down here. Will, you're from a different area of the country. Obviously, you're kind of a small town guy. What could a program like FIT have meant to your area? Again, going back to that, and what are some of the challenges of kids that are in the 7th grade? Again, you're a lot younger than us here, so you're closer to 7th grade than me. What are some of the challenges that these kids face on a daily basis?
You know, at middle school at that age, they're in such an influential state or time of their lives because that's when they're getting imprinted on with all these ideas and things, what they want to do, their peer groups. They want to be cool. They want to do all the cool things, have all the most updated stuff. And a program like that is very beneficial because, again, you want to jump in and imprint on these kids early and young before they get into high school, before they're forming all these groups and ideas of who they want to be and how they want to do it. And it's very important for things like that to get in and lead these kids right away because again they're being very influenced right now, and that's the time of their lives where you need to jump in and lead them the right way.
Now, obviously, you can't do this alone. The Redskins have a lot of great partners. Tony mentioned a couple of them. And to go from the business sector to a professional football team back to a public school system and tie that all together, that's not the easiest thing to do, to get all those pieces working in the same direction. Talk about a little bit about the support that the foundation has and the Redskins marketing department, which also supports the foundation with a variety of companies.
Folks, football is the ultimate team sport, not only on the field, but off the field, like Larry said. So the foundation will partner with the marketing department, will partner with the foundation and other corporate partners to get the common goal, and that is to having an impact in the community and encouraging kids to be healthy. And that's something that I'm very proud of this organization of doing because, Yes, we do things on Sundays, but the impact and thousands of kids that you really make a huge impact for off the field is something that's really special.
I know we're on a tight schedule here, and I would like to take a poll. Any Redskins fans here? Any Redskins fans?
All right.
Cowboy fans? Do we have Cowboy fans? Yes, Dolphins fans? Eagle fans? Eagle fans? I invite you to come out to Redskins Park and see something you've never seen before. It's called Super Bowl trophies. Got a couple of those. Got a couple of those out there. Any Giant fans? Any Giant fans? Sorry, I had to do that. So I thought it might be a good idea, since we do have a fast program here, to ask Will a football question. Is that okay with everybody? Yes, football question. So Redskins came off a year last year where you guys won for the second year in a row, but you didn't go to the playoffs. Off-season is very busy. We hear so much about contract negotiations. You yourself have contract stuff coming up. So, but sitting here, middle of February, we haven't played a game yet. What's the outlook for the Redskins in 2017? How good can the team be?
Obviously, personally, I think as a team, the sky's the limit. I do think we have all the right pieces in place. We got to do some things free agency-wise, draft-wise, to build, a better team. But I think we have the right leadership in place to lead the organization to a Super Bowl. And, at the end of the day, it's about, we all have to figure out why we do it, because we all know what we do, we all know how we do it, but it always starts with why. And I think once a team comes together and figures all that out, it's a scary football team.
I like the sound of that. Tony, a final word from you on the foundation again, and we're so honored to be here on behalf of the Redskins. We do put a lot of time into the community. Calvin's here from the foundation. We appreciate him coming down here with us, and it's an ever evolving effort between the different area locations. You have Loudoun County, Fairfax County, Montgomery County, where I'm originally from, DC Public Schools, Prince George's Public Schools. We really have an imprint all over the region, and really helping kids is at the heart of it. And this is really this event here is right in line with the way our foundation operates, between the ultimate goal of helping kids and then trying to pool the resources together from a variety of different areas to make it happen. It's not the easiest thing. So maybe a final word from you on the foundation and what the future lies for the Redskins Charitable Foundation.
All I can say is just being heart, being charitable. Everything from whether it's a football field in Loudoun County to school visits, the READ programs. We have tons of different ways to touch different kids, and it's something that's very special. I mean, this community supports the organization, so we in turn support the community through our charitable efforts. I mean, it's something that Dan and Tanya Snyder really believe in, and we just execute it. And it's something I'm really proud of, and I think you guys are too.
All right, ladies and gentlemen, Tony Wiley, Will Compton, thank you for being part of this today. I'm going to stay up here, but check out this video on a partnership, Samsung and the Center at Children's Health Fund. Take a look at the video.
Welcome to 21st Century Mobile Pediatric Care. The latest and greatest Children's Health Fund mobile pediatric clinic funded by Samsung will advance mobile health care for children living in poverty through state-of-the-art technology. Advanced telehealth technology will allow patients to be seen by specialists in far-off locations, and that alone will increase access, convenience, and quality of care. Each exam room will be equipped with flat-screen monitors and tablets loaded with interactive health education software. Printers in each exam room will let doctors produce real-time critical information and customized health education materials for patient care support. Tablets in the waiting area will let patients review health education materials or watch videos on health topics and complete health assessments, making far better use of waiting time and enhancing the care experience. Electronic health records, pioneered by Children's Health Fund, address the vital need to maintain accessible, accurate patient information in a mobile healthcare delivery setting. Special Samsung GearFit bracelets will allow team members to communicate more efficiently and protect patient privacy. An external flat-screen display will show health videos and clinic schedules and other information. With this latest technology from Samsung, the new mobile pediatric unit is poised to change the face of mobile care, bringing improved access to health care for children and their families.
What a fantastic partnership. As you saw, Samsung Innovation Center, Children's Health Fund committed to delivering high-quality care to America's most disadvantaged kids. And now I'd like to introduce Dr. Delaney Gracie, Chief Medical Officer at Children's Health Fund, and Ann Wu, Head of Corporate Social Responsibility for Samsung. Thank you, ladies. Ann, why don't you start? That was a fantastic video. It gave us a little bit of a glimpse of what this partnership's all about. Could you tell us about it?
Sure. So first off, we're so excited to be here and talking about this wonderful project. We've been a partner with the Children's Health Fund since 2014, and we started out with an interest in mobile medical units that the Children's Health Fund supports all across the country. But this partnership, the Samsung Innovation at the Children's Health Fund, is really a joint initiative by both parties to really explore how we can improve both the access to care and the quality of care for the most underserved children in America. And that's been really near and dear to our heart.
Dr. Gracie, your thoughts on the partnership from your perspective?
Well, I totally agree, and it's been one of our best partnerships that we've had. And there's a couple of reasons for that. I mean, absolutely, Samsung supports us philanthropically, which is great because that helps us bring the care to the kids across the country. But this partnership, it's so much more than that, and that's what makes it special. From the very beginning, our teams met for ideation sessions to really bring the best from both of our sectors and our teams on how could we make it better, not just how could we bring the same things to kids who really need those things, but what could we do that's new? How could we leverage technology? How could we leverage systems and thought processes that Samsung had paired with our knowledge and insight of underserved kids? And how could we do even more, which I'm really excited to say that we certainly have.
And could you go in a little more depth, because the company is going to look at different opportunities and try to find a way to give back to the community in a big way. And Dr. Gracie mentioned how this was a good, perfect partnership. From your perspective, as you guys evaluated how you were going to move forward, what was it about this partnership that made you really want to do it?
Sure. So I think we're both purpose-driven, mission-driven organizations, which has been really great for us because we come with a common philosophy and approach. We also both believe that technology can do great things. It can change paradigms, create shortcuts for the delivery of, for example, a service or care that might be otherwise difficult to get. So because we are like-minded and we were both coming in with an idea of learning as we go, and leveraging the strengths of both organizations, we actually have evolved the partnership over time and learned that the best way we can partner is by bringing both sets of knowledge together for a common good.
Are you guys in constant contact?
We talk a lot.
We know about each other's kids, and yes, definitely.
And so you obviously have common goals. So what are some of the specific health needs, health issues that the program addresses?
Sure. Well, I'm not sure if you're familiar, but more than 1 in 5 kids in this country live in poverty, almost 1 in 4 now. So that's those kids, that's all of their families. So if you think about it, that's a big part of the communities that all of you work in. Our kids have a lot of challenges getting to healthcare and getting to quality healthcare, and that's why things like the mobile clinic, like you just saw, allows us to bring the care to where the kids are. And this mobile clinic that you saw is in San Francisco, and it has even better technologies to engage with the patient, to educate with the patient, and to be more efficient when we do that care. But our partnership, we offer a lot more than that as well. We're doing telehealth, we're doing vision screening with automated vision screeners. We can screen the vision of a child as young as 6 months old. We're doing some, work with asthma monitoring where we can actually follow the patient in real time. Lead testing where we get the results right away, which, when you're working with a homeless population that you may not know where that kid is next week, being able to get results right away and make that care plan, that changes everything. So it makes our care better, it makes it more efficient, and we're able to reach more kids. We have better things on the mobile clinics for our kids that we take care of than we have in my daughter's clinic in Westchester, New York. So it's great to be able to give those best technologies and opportunities to the kids that really need them most.
And from the company's perspective, how do you measure success for this partnership? When the NFL, it's wins and losses. It's pretty simple. It's a W or an L. How do you guys measure success?
Sure. So there's the classic qualitative and quantitative measures that we look at, how many health interactions there are and the like. But the really important thing for us as part of this partnership that we think is a measure of success is the ability for us to take the learnings that we've gotten as in this endeavor and really make sure that learning is shared with other organizations, with other healthcare providers as well. One of the key things for technology is it shouldn't be owned by a few. It should be something that's shared and just iterated upon and improved upon over time. So one of the measures that we think is success is really who else is learning, who else is taking and adapting and improving the things that we've started to embark on.
The term culture of health is in the script several times, and I think that it's important for you to describe. My culture of health for my kids might be different from some of the kids who are targeted by your program.
Yes, although, what we'd like to have it be is that it's the same for everybody, that everybody has, access to good health care, quality schools, opportunities, support, and it takes the whole community. And as I was saying, this is a quarter of our community, so unless we weave them into the plans for culture of health, we won't really get there. And I encourage you, as you're making your plans, and I'm so excited to be with you because you're obviously so motivated in this direction already, but definitely think about what you're bringing to the community. Can kids in poverty and their families, can they access it, or does it need to be offered in a slightly different way? That's one of the things we've really gotten from the work with Samsung. So for example, we're doing telehealth in rural Miami and right on the border in Arizona. So before, our kids were able to see the specialist that we would refer them to maybe 30% of the time because it was about 2 hours away, and for a lot of reasons they couldn't get there. With the telehealth, we're at about 90%, so it's making a huge difference.
So that communication between the two partners is so important, and you guys have learned a lot of lessons along the way, and it sounds like you're communicating what you've learned along the way to help improve the program. Could you speak on that in a general way? How important is it for you guys to keep communicating, especially when you learn something that could be a key to the next program or the next program?
Well, building off of what Ann said before, we absolutely agree that, it's not just our mission to take care of the 90,000 kids that we provide care for across the country, but how can we use that information to build models and understand strategies that then everybody can learn from and everybody can benefit from. So we present together, we present all over the country to, and we're always willing to teach people how to implement what we have done. And I think that's a value that we carry, strongly.
As a member of your company and the business community, how does this partnership align with the company's goals?
Sure. So we have, as one of our company values, the idea of co-prosperity, and that's really important. And we really definitively believe that business success goes hand in hand with helping out the community and being a member of that society, so as a whole. So it's really important for us to be present, to get involved, to share what we know about technology and how technology can really do different things and change paradigms, and really work with partners that have a common goal, as I mentioned before, and really move the direction forward.
Go ahead.
That's been one of the really great parts about working with Samsung is that everybody that we've met, and especially in working with Ann, you can really tell they're really in it for the kids. It's not advertising, it's what can we do to change the world, how can we use what we know to make things better across the board. So it's a pleasure.
How would you like this to move forward? What does the future hold? For you first, Dr. Gracie, looking in your crystal ball, maybe a year down the road, what are you hoping to succeed at?
Well, certainly I'm looking forward to continuing to work with Ann and Samsung because I think it's the tip of the iceberg of what we can do and what we're understanding about what the kids' needs are and how we can utilize technology to meet that better. I think technology in particular has the potential to actually increase the gap of disparities because, for example, a lot of our families, they don't have Wi-Fi. They don't even have consistent phone service. So are the things that are out there going to help them or actually increase that gap? So I think partnerships like this, we're very, very mindfully trying to make sure that the opposite thing happens, that actually the technology really decreases this disparity. And I hope that's the way that you guys will all work with partners, and I hope that becomes the industry standard is, how do we use what we know to, raise the quality of health and create a culture of health for everybody.
And you get the final word. Same question to you, looking down the road. How would you like to see this program grow on behalf of your business and some of the successes you might look forward to in the future?
Sure. So we're really excited about continuing the partnership. again, technology can do some fantastic things, and we don't assume that we know what Children's Health Fund knows, but in our interactions and as our partnership evolves, we can be more of a contributor to that overall mission and goal of the partnership.
It's a great success story, ladies and gentlemen. Big round of applause for Ann, Dr. Gracie, for stopping by today. And thank you so much for having the Washington Redskins here at the Chamber of Commerce today. It's been our
Keep
pleasure.
that going for Larry Michael, if you would, please, and for the Washington Redskins. Thank you guys so much for spending the time with us today. We're really excited by everything you had to say, and I really want to thank Samsung and the Children's Health Fund for that great work that you guys are doing. That very same mobile clinic that you saw up there in the video is actually going to be open right out through those doors. There's going to be a door that you can go out to the outside, and you can go and visit the mobile health clinic starting, I think, about 10:45, and that'll be open all the way through lunch. So I hope that you will take the time to go and visit that. A quick programming note for you. After this next session that we're about to do, we're going to move into breakouts. When you do that, you will need to take your stuff with you because they're going to reset this room for the Incredible Healthy 10 Awards, which you will definitely want to come back for. Not only is there free lunch and great prizes, great awards to hear about, so please join us back here in that room after the breakout sessions. Now we're going to transition into our next session on our health champions. And one of the things that we've heard so much about over the last, I don't know, what has it been, 20 hours or so, has been the importance of making connections. And I think that's the real point of these health champions and of the Health Champions Network, is the opportunity to see and interact with one another. And to help us kind of kick that off, I want to introduce a video by Mike Gordon.
Hi, my name's Mike Gordon, and thank you for giving me the time to share my experiences with you. As president of the Chicago Wolves Hockey Organization, it is my job to oversee all of the business aspects off the ice, including sponsorship, ticket sales, and community relations. A key component of our community relations is to promote healthy lifestyles and healthy living choices. We have created initiatives to access the over 10 million people in Chicago who are both families and fans. Since 1994, when the team was founded, I'm proud to say the Wolves continue to promote physical activity to today's youth. Through our Howl for Your Health program, we reward kindergartners through 8th graders with a complimentary ticket if they are able to improve their physical fitness scores year after year. I'm so proud to be a part of the Health Means Business campaign. It brings to light the issues of health and nutrition that is currently facing our nation. The efforts by the U.S. Chamber Foundation and the Robert Wood Johnson Foundation is commendable. Thank you for all your efforts in helping Americans be as healthy as they can be so they can perform to their peak, and to ensure that we can compete for years to come. I've taken the Health Means Business Wellness Pledge. Won't you?
How about we give a big hand to Mike and all the Chicago Wolves? You know, Mike joined us for our Chicago Forum, and if you haven't seen it, he did a great video that they actually played during one of the halftime periods for one of the games. It was a really incredible and very moving thing to watch. You can look it up on YouTube. In every American community, businesses have the ability to shape discussions and influence community health. But as you all know, we can't do it alone. We really need strong peer-to-peer relationships and networks that can be supported by information and tools. That's why the Health Means Business campaign launched the Health Champions Network to provide tools, resources, and a platform for peers to learn from one another. And I think if you do nothing else while you're here, connecting into that Champions Network will be the way that you'll be able to take much of what you learn back home to your home organizations and to your home communities. The network empowers businesses of all sizes by providing them with online and offline tools and training, practical steps, and peers that they can interact with to help build the health and economic outcomes of their communities. Many of you in the room are already members of the Champions Network. If you haven't already joined, I encourage you to take the Wellness Pledge at healthmeansbusiness.com or by signing up on one of the iPad stations out in the other room there. Today we're excited to feature some of the health champions we've met throughout the campaign. Our very first one is Dr. Jerome Adams. Jerome is the Indiana State Health Commissioner. In this role, he oversees the public health protection and laboratory services, health and human services, healthcare quality and regulatory, and tobacco prevention and cessation commissions. Dr. Adams, you and I first met at our Indiana Health Means Business Forum last February, and we're so grateful you could join us here today. Ladies and gentlemen, Dr. Jerome Adams.
Well, good morning, everybody. You doing okay? It is a pleasure and an honor to be here to introduce the Health Means Business, or Champions session. And I bring greetings from Vice President Pence. We actually in Indiana were the first state to award or to name a Health Means Business Day when we had the folks come out to Indiana. And so we're really excited about that. You know, as health commissioner, it's my job to get everyone up and moving, and I hope you all saw on the table the great conference call workout sheets. But we're going to do a quick conference workout. I want everyone to stand up. Get your legs moving. Shake it out a little bit. Shake it out. There's going to be choreography, too. So I want this half of the room to make a muscle time, and this half of the room to do a Johnny Manziel dollar bill time. And folks who know me know that I like Twitter and I like selfies. I'm at Jerome Adams, MD. So the choreography is going to be, this side's going to say health, and this side's going to say being business. So I want everyone on this side. Are you ready at the count of 3? 1, 2, 3. Health. All right, it'll be business. All right, we got to do that again. One more time. 1, 2, 3. Health. Do that again at the end. You know, I'm the Indiana State Health Commissioner, but I've told some of you folks in the audience, my business card does not say Indiana, a state that makes you healthier. It says Indiana, a state that works. And that's what resonates with our voters and our decision makers. And I truly believe you can have both if you have the right partnerships in place. That's why I welcome opportunities like this to promote the economic benefits of a culture of wellness. I've been very fortunate. Yesterday, I had the opportunity to meet with our new Secretary of Health and Human Services, Tom Price. And this message really resonated with him. For the health folks in the audience, who considers himself a health person? Raise your hand. My message for you all is one that you heard earlier. We've got to stop making the health argument for health's sake. The moral argument is necessary, but it is not sufficient to carry the day. We've got to frame it in terms of the economic bottom line. For the businesses, do we have reporters in the back of the room? Any reporters, businesses, raise your hand. All right, for all the folks who are businesses, take this down, you all can tweet this. You will not be able to compete in a global marketplace if you do not address the unwellness of our workforce. That's the take-home point from today for all of you. You've heard a strong case for the economic benefits of workplace wellness. Let me expand on that a little bit. A 2012 Gallup poll of almost 7,000 successful entrepreneurs found that the top 2 priorities for cities that want to enhance a culture of entrepreneurship are, number 1, making sure every neighborhood has safe places to exercise, and number 2, enhancing access to fruits and vegetables. This is important because we know healthier workforces are better for a company's bottom line. Healthcare costs are the number 2 expense for most employers behind salary, but it's not just about healthcare. You heard earlier, there's less absenteeism, and there's more productivity when your workforce is healthy. There's also a benefit outside the workplace because a community that fosters a healthy and productive workforce will be more attracted to families as a place to live and spend their money, and for other businesses to relocate to. Wellness in the workplace can be as simple or as elaborate as you want to make it. But many companies, especially smaller ones, don't know how to get started. That's why it's so important to identify potential partners and to find out how you can all work together. The good news is you don't have to do this alone. That's what the Health Champions Network is all about. I recently learned how a collaborative approach had played out in Putnam County, Indiana, a community of about 10,000 people. Like many Indiana counties, Putnam County has health challenges. Nearly a third of their adults are obese and 20% smoke. Leaders felt these factors were hurting their businesses in terms of health expenses and also made the county a less desirable place to work and live. The hospital in the area helped form a community coalition focused on health as an economic development and recruitment tool. Though focused on health, I talked to the hospital CEO just yesterday, and he said that if the effort had been solely led by the hospital, in his words, it would have been doomed to failure. But because they built a broad coalition among employers and businesses in the county, and framed their efforts in terms of economic development, they had a much easier time getting buy-in. Putnam County's example also shows that players of all sizes have something to bring to the table. The hospital found that large corporate players like Walmart didn't need help developing wellness programs. They already had them, but they were willing to share their best practices with small and mid-sized employers and create toolkits that would help less resourced employers build their own wellness programs. They, in essence, created their own local health champions network, and now you all have a larger health champions network to tap into and you're going to hear some great stories about that today. These are the types of networks we need to lean on nationally and build locally if we're ever going to fully integrate health into our workplace. I encourage you all to think about the types of partnerships you can help build in your communities. Wellness in the workplace doesn't have to cost a lot. The benefits to the employees and to the company's bottom line are immeasurable. So I'm a doctor, I've got to leave you with 2 prescriptions. For large businesses, number 1, step outside the workplace. You've been successful in many ways in terms of workplace wellness programs, but keep them healthy during the day from 8 to 4. What happens from 4 to 8 when they go back home? Are you weighing in with your local decision makers to help make sure you have the proper policies in place to keep your employees healthy when they're not on the clock? To small businesses, just pick one thing. You just got to get started somewhere. Take one thing from these 2 days and go back home and do it. Just get started. And then you can roll that into a larger, more comprehensive program. We all win when we create a culture of health at home and at work, because health means business. Thank you all very much, and I really look forward to hearing from some of the other champions that are going to come up next. Richard?
Big hand for Jerome, please. Okay, so as you can tell, I'm kind of roving around here in the audience. And the reason why, 2 reasons for that. First of all, really thank you, Dr. Adams, for that great tee-up. But we positioned several of our health champions here in the audience for 2 reasons. One, just to break up the visual here so you can see me down here instead of up there. But also, more importantly, what we really want to communicate to you is that each and every one of you are health champions. And we've embedded these folks here at these tables, and actually in tables all around the room, so that you can connect with them and get direct input from them on their ideas. And I want to first bring up Chuck Gillespie. Chuck, you're the Executive Director for the Wellness Council of Indiana. You were so helpful for us when we were in Indiana. Tell us, what's going on? What are you seeing in Indiana in your workplaces and communities there related to health and wellness?
Well, the good news is you heard most of it from Dr. Adams, and it's been a wonderful relationship that we've had with the Indiana State Health Department and what Dr. Adams has done in the state. The other unique thing that we have going is the Wellness Council of Indiana is actually a part of the Indiana Chamber of Commerce, and because of that, we really have taken that economic development approach to the health and well-being of our employers. The other piece that we really have taken a big advantage of is our ability to look at these communities like Putnam County. We are working really closely with them on our Indiana Healthy Community Initiative and letting them build what they want to do in their community so that they have that ownership. We're not telling them what to do. We're asking them what do they want and then helping facilitate that conversation. But the piece we really see is the opportunity to say, hey, let's look at this from an economics perspective, not just health for health's sake. And I think that has been the biggest eye-opening experience that we've seen. And it's been a lot of fun to watch the light bulbs go off.
So really listening to what they need, going in and helping them where, not telling them, but bringing resources where they need them. Now, I know you're also working on this Healthy, Wealthy, Wise Index. Tell us what that's all about and how are you using it to measure effectiveness?
What was really nice is, listening to Hank and Lawrence talk about what they have done through the Hudson Institute. We've done a very similar piece, but again, taking that economic approach to it as opposed to more of a health approach, more of a clinical approach. And with the Healthy, Wealthy, Wise Index, we've taken a number of different factors. We've taken poverty, we've taken learning ability, we've taken earning ability, and at the same time taken about 12 different health factors. And we've done it county by county, so each county can see exactly what they're doing from that perspective. But we're saying there is such a distinct difference or a correlation between the health of their residents as well as their learning ability and then their ability to earn. And by doing so, we've been able to help them identify in the Putnam counties and the 12 other communities we're working in right now to help them better track how they can look at their workplaces, how they can work and understand spending less money on their data and more points on solutions.
So they can tap into this data and they can use it to...
It's right on our website.
Excellent. Give Chuck a hand if you would, please. Now, I want to hear from a couple more of our champions, and I'm going to come to you guys for your questions, both for Dr. Adams as well as for all of our champions. Our next one is Susan Gronwald. Susan, you were with us when we were in Chicago. You're a PhD, a registered nurse. You're the president of the Chamberlain College of Nursing. How do we create a culture of health at work, and where in the community should we start?
Well, I'm going to give a story about how we started in our own community right at our college. So we're College of Nursing, and we have a very, very bold vision, and that is that we create an environment where our students and our employees can thrive. And Will said, why? The why is so that we can graduate extraordinary nurses. So you probably all have a vision in your mind of what an extraordinary nurse is. We decided that we needed to model in our culture the kinds of values and attributes that we want in extraordinary nurses. So we decided to intentionally create a culture of care. Again, why? Because that's at the top of the list of attributes of an extraordinary nurse. And also, we have research that shows that in education, when students feel supported and cared for, they do better. So we embarked on this journey a few years ago, and there's 3 pillars to the culture of care. The first is care for self, which we've been hearing a lot about these 2 days. And that's about you have to bring your best self to work in order to be productive and get the best results. If you can't do that, you can't care for others. The second pillar is caring for each other as colleagues, because we want an environment where people can be respected and grow and thrive. And then finally, care for our students, because they're the future nurses that are going to care for thousands of patients in their career. What was surprising about that, the bottom line is that what the pillar, the foundation of it all, was just even communicating to our employees that we care about them, we care about their health, and we're going to create an environment where they can take care of themselves. We got such feedback that went viral in our organization because people said, I've never worked for an organization that cared for me in this way, and by you caring for me, I can then be a better employee and care for others. So my message to everybody, and some were asking about it yesterday, how do I get started in a small company without resources? Culture is where healthy business starts, and everybody can affect that.
So what I'm hearing is a great story of ripple effects. If I start with caring for myself, then I start caring for my colleagues, I start caring for, in your case, students, but maybe for my customers or for others, that can just ripple out into culture of care for the whole community.
Absolutely.
And talk to me about the power of networks. I mean, this is what the Health Champions Network is all about. What are you doing to really leverage networks there in Chicago?
Well, we have 27,000 students around the country, nurses, and nurses, I think businesses don't often think about how nurses can help by serving on a board if you have a board. But I made the offer in Chicago, and I want to make the offer here as a champion, that we have 27,000 students that have projects that they have to do. And they're very involved in community service, but why not use a nursing student, either from Chamberlain or from your local college, to help you do education or participate in helping you design a program at your institution. I make that offer. If you want to contact me at info@chamberlain.edu and let me know your project, we'll try to match you up with a student that also has a need. We'll kill 2 birds with 1 stone.
You know, you brought this up when we were in Chicago. Dr. Montgomery Rice actually brought it up when we were in Atlanta. One of the things we often hear from employers is, I don't know how to have these conversations, these sensitive health-related conversations. You offered nurses, Dr. Montgomery Rice offered medical students. I'm sure other medical schools and nursing schools would love to hear from employers.
Absolutely,
Yep.
absolutely.
Excellent. Give Susan a hand, please. Coming next to Mike Finney. Mike, you're the president and CEO of Community Ventures Resources there in Ann Arbor, Michigan. You know, we've heard a lot about the skills gap. We hear a lot about that today. A lot of people think about the skills gap, and they think mostly about kind of those higher level skills. You're doing a lot of work on identifying and matching people with lower or unskilled professions or jobs. How's that going for you?
Yeah, so Community Ventures is an initiative that launched in 2013 as a way to really get at crime and violence that we had in 4 Michigan cities. If you look back at that data, Saginaw, Flint, Pontiac, and Detroit, Michigan were all in the top 10 in violent crime in the United States. And our governor at the time wanted to do something positive to impact crime and violence. And what we quickly discovered was there was an incredible connection between crime and violence, poor education, poor health, for people who were in poverty. So we quickly shifted our efforts away from focusing on exclusively trying to solve a crime and violence problem and decided to see if we couldn't have a positive impact on poverty. You know, we've talked about this health and wealth equation here today and yesterday. Well, we're trying to deal with the wealth side of that equation. And sometimes when we think about poverty, we don't think about wealth. But if you're living on $2 a day, a living wage job creates wealth. And so we focused on identifying and connecting individuals who were living in extreme poverty with jobs that paid a living wage. And it's incredible what we've seen. Now, we haven't done the research to understand if it is, in fact, data-driven, but we see a lot of anecdotal information that suggests that individuals who have participated in our program are having better health outcomes, they're having better education outcomes, and of course, crime and violence is being solved in their communities.
So we've heard a lot about the social determinants of health. We've heard a lot about the impacts of poverty on health. You're saying if we can tackle the wealth side of that equation by getting unskilled or low-skilled people into jobs, that helps them build wealth and helps improve their health outcomes.
Right. My opinion, not based on research, but we are in fact working with some professors at the University of Michigan to really do some randomized studies to begin following some of the 4,000 plus individuals that we've helped place into jobs to really understand if in fact there's a direct correlation.
Now, if companies want to work with you, how should they come talk to you?
Very easy to reach us. CommunityVentures.org is the website, or you can reach me at michael@CommunityVenturesResources.com.
Beautiful. Give Mike a big hand if you would, please. And lastly, and then I'm going to come to you guys for your questions. We have Rachna Govani, the CEO and co-founder of Food Stand. You guys are in New York and Detroit?
Correct.
Is that right? Now, health, for me at least, sometimes can sound kind of tedious and nagging. You guys are making it fun. How are you making it fun?
Yeah, so Food Stand is the app to help people build healthy eating habits without diets or calorie counting. Instead, we take a behavior modification approach. So what we do is we sort of break down this concept of just being healthy into very small micro challenges. And we heard the Surgeon General talk about this. We heard Ariana talk about this yesterday, doing challenges as a way to get people to change one thing. So that's what we focus on. You can learn how to quit soda. You can learn how to get added sugar out of your breakfast. Simple things like that. And our focus really is on getting people through one of those things at a time. So ultimately, you will be healthy by changing these few trigger behaviors.
And it's challenges between me and myself, between me and my colleagues. How does that work?
So this is where the network effect gets really powerful. So you can challenge yourself, but we have a community of people in about 60 countries now who are doing these challenges.
Wow.
So you're working with other people, and now what we're rolling out is doing these challenges with teams. So it could be your coworkers, it could be your church group, it could be a sports team, where you all work together to hit a target. You want to eat 1,000 servings of vegetables by the end of the month. We help you do that.
So we heard yesterday, I know there's a question from the audience about working in virtual environments. The Surgeon General talked about this lack of connection and the need for this connection. So you guys are helping to build that connection.
Absolutely. And we see this already where we have members in physical proximity working together, where we have a group out in Maryland actually that's doing this with their whole office. But then we also see family members who are across the country who are doing this together. So you have the virtual connections happening and you have the physical connections, which we know when we think about healthier eating habits, we know people are better eaters when they're around other good eaters. So we're trying to facilitate that both in person and virtually whenever possible.
And people just download the app?
Yeah, so you can get the app. It's Food Stand, all one word, in the iTunes or Google Play Store. And then if you guys want to talk about team challenges for your offices or for your companies, just send me an email, rachna@thefoodstand.com.
Beautiful. Give Rachna a hand, if you would, please. Okay, we've got time for a couple questions. Who's got a question for one of our champions or for Dr. Adams? There's prizes for quite good questions. No, you got a question? Yeah, tell us your name and organization, please. And who's your question?
My name is Mary Stoner Saunders. I'm from Chicago. Enjoyed this conversation all around, and I particularly have a question for you because of the work you do. I work for a new organization called Strides for Peace, which tries to bring resources to community partners to end gun violence in Chicago. We've lost 3 children in the city of Chicago this week, 12, 11, and 2 years old. That has a human, social, and economic cost, both in terms of the employees who live in those communities, the communities themselves, the economic viability of Chicago as being able to attract talent and companies. So a question I have I'm very interested in is about outcomes. We heard earlier this morning about getting stuck on short-term returns when we're trying to solve long-term problems. And so when you talk about the work you're doing and it's not, randomized trial study, I'm curious, how do you deal with proving to your constituents, your funders, the public, other businesses, that it's worthwhile investing in longer sustainable outcomes rather than going for the quick fixes and not dealing with the real problems on the ground.
So how are you measuring impact? How are you?
Yeah, that's a great question. So I'm very fortunate that we have a governor in Michigan who really thinks long term. He actually came from the business sector, but he really gets the need for us to think about the long-term effect of what we're trying to do. So in the short term, though, we designed this initiative so that it actually is a pay for performance. I can tell you that the ROI for the program Community Ventures is about 20 months. So in other words, for every dollar the state of Michigan invests in Community Ventures, it's returned within 20 months. And that's an important factor when we're trying to sustain funding from sources. Now, I am working on getting funding also from philanthropy because they represent an opportunity to scale this program beyond the 4 communities that we're actively working in right now. And I've already put together a plan to scale this as a national model for how to solve for poverty in selected communities. I've already met with some folks in Chicago. I'd be happy to talk with you a little bit later. I've met with folks in New Orleans, Cincinnati, Rochester, New York, La Crosse, Wisconsin, Milwaukee, Wisconsin, and I probably missed 1 or 2 others. So it definitely has the potential to be a national model. And I've spoken at several national conferences where I do a detailed workshop. And from those have come some of the leads that I just mentioned in other cities.
How about a big hand for all of our champions, Chuck, Susan, Mike, Rashna, and Dr. Adams.
So, are you feeling inspired? I know that I am. Do we have the slides here? There are 3 simple steps that you can take to joining the Champions Network and getting access to all of the accumulated wisdom of this Health Means Business campaign. When I look out at this audience, what I see are actually all champions. Every one of you has amazing stories, amazing work, incredible heart for what you're doing, and we want to share that, we want to know about it, and we want to let others know about it. So the first step is really simple. Just take the Wellness Pledge, pledge card on your tables, out at the stand out front, and then also, or on the online, very simple, just fill out the form. The second is to share and engage. Join the private Facebook community. This is all of the folks you just heard from are members, and this is where we can share and celebrate our successes, our strategies. Sometimes we can ask questions or talk about our struggles, and it's a great way to kind of keep the momentum going from a wonderful mountaintop experience like this event. Also, there's the live Twitter feed, which I love because I work up in kind of the boondocks in upstate New York and Connecticut, and I can follow on with whatever's going on in Sacramento or rural Georgia recently. So subscribe to the Twitter feed. Third, the Online Resource Center. So the Online Resource Center is the website. It is where all of the accumulated wisdom of this campaign resides. There are 2 primary navigation paths: invest in your organization and invest in your community. Organization meaning your workforce wellness tips, and community obviously building culture of community health. One thing that's really important for you to know is that this site is chock full of road-tested stories and tips and tools and information that we know works. It didn't make it to the cut on the website unless we had heard from multiple people in different places across the country or our national partners that these simple strategies worked for them. If you look at, there we go, invest in your organization, the workforce wellness part, for example. One of my favorites on this page, you can scroll down a little bit, is from the Denver Chamber. We've talked a lot about strategies and tips for doing challenges. Well, Denver, being Denver, took it to a whole new level. They have something called the Summit Club. So the team measured the height of their staircases, and they figured out how many stairs they could climb in order to equal a Colorado mountain summit. And does anybody know how many feet that is? Yeah, I heard it, 14,000 feet, exactly. When someone climbs the stairs often enough to reach the summit, they actually join the Summit Club, and they report that they've had multiple employees reached the summit multiple times. Investing in your community. You heard yesterday the folks from GSK talk about the zip code life expectancy locator. That's on this site. You just click on zip code right there. It takes you to the indicator on the Robert Wood Johnson Foundation site. You can then look at an area that in your community that has the greatest need, and then you can come right back to the online resource center and you can get started with one of our, we have some deep dives and we have the 8 strategies and tips for getting started building community health. If you have a little bit more time, most of the content is designed to be read and absorbed in 5 minutes because we know that business people are busy people and we need to know it's going to work and kind of get started in inspiring our own creativity. But if you have a little more time, you can go to the Champions Handbook, see the whole thing, business cases, ROI, all put in one place. And we even have, thanks to our team here, the secrets for creating a magical event like this. And forum, things about how to facilitate, press, et cetera, in our forum handbook. There is so much more than I can possibly share up here. So I encourage you to go to the links, join the Champions Network, come see me, and I look forward to seeing you online. Thank you.
How about a bigger hand for Margaret Gifford, if you would, please? Margaret is the head of our Health Means Business Champions Network, and I hope that you will really tap into her. Those resources, and she personally, are fantastic to help you think through the programs that you might want to bring to your communities. Now, it's time to get moving. So up next, we have a terrific little conference call workout brought to us by Sodexo. Help me to welcome back to the stage Jackie Sharp-Womble, the Senior Manager for Health and Wellbeing at Sodexo North America.
Hello, hello, hello. All right. You guys need to get moving, don't you? Yeah? Okay. So we have a couple minutes. We are going to get the blood moving, give you guys a little bit of a break from just sitting here, and we are going to walk him through. You're going to be my volunteer, right?
I was voluntold, yes.
Voluntold, yes. Don't worry, I won't hurt you. So first, did you guys know that sitting is the new smoking? That it increases your risk that much. And also, did you know that every bout of exercise that you do helps reduce insulin resistance, which helps balance your blood sugars? So, no matter if it's 5 minutes or 15 minutes or 50 minutes, you are doing your body good by moving and getting that blood flowing. So, everybody stand up. If you have bottled water or one of these nice naked pressed juices that they have out there, use these for your weights. You don't have to have them though. And this just shows you that you can get anything that has any type of weight to use. You don't have to have actual weights. However, you could use those in your office. Also, do you guys see, is there the slide that we're going to put up? On your tables, you see the little cards, and they say conference call workouts. That's the workout we're going to do. So everybody look at yeah. Take a look at those. One side's got healthy snacks on it. The other side has the workout on it. Feel free to take that home and put it in your office. I'm going to put you in the middle. Okay, so the first thing that we're going to do is just stand here, put your arms by your side, relax, take a deep breath in, and exhale. Hold that exhale as long as you can. If you think you can't breathe out anymore, breathe out again. Do it one more time. Inhale and exhale. Okay, great. Now we are going to start with our text neck rolls. You guys know when you're sitting at your desk and you're just kind of like hunched over like this and you're typing and your shoulders are hunched over. Yeah. So we're going to just go back to one. Put your left ear to your left shoulder. Hold it right there and then slowly go around to the right shoulder. Sorry. And back around. And one more time, great. Now we're gonna get moving. So take those weights if you have them. If you don't, just use your hands. The point is not to break out into a sweat because you have a meeting you're about to go to. So we are just getting that blood moving. So you're gonna do, hoping for a raise, arm raises. Chest out, arms down by your side. And you're just gonna lift up and out and then down. And we're gonna do it again, up and out and down. Yeah, I should say you should move so you don't punch your partner in the face. And down and up. If you can't do this for any reason, just stand up and move around. There's modifications that we can do for a lot of these. So if there is, for whatever reason, you can't do them, do not force yourself, please. Okay, now we are going to do, what was next on that page? Somebody tell me. Yes, the arm circles. So we are gonna have arms out like this. And when you're doing this, engage your body. Squeeze that core, squeeze those glutes, squeeze everything. And you're just gonna go back, roll little circles like this. And for the sake of time, we are not gonna do these, we're not gonna do multiple sets of these, but when you are in your office or if you're on a conference call, go forward, you can absolutely do multiple sets of them. Do 3, 5 sets, however long your call is. Wonderful. And back, how your arms feeling?
Great.
They burning?
A little bit.
And forward.
These weights are making a difference.
Yeah, You got about 3 pounds right there. And back. You guys feeling that burn? Yeah. And forward.
Feeling the burn, Jackie, feeling the burn.
You guys are gonna walk out of here sore. You're not gonna lift your arms after this. All right, now slowly go down. And what is next on my card? Are we doing lunges next? Curls. Okay, so this is a good one. You can do standing or sitting. You can do any of these standing or sitting. Arms down by your side with your heavy weights, and you're just gonna slowly go up and down. And if you don't have weights, create that resistance. Kind of push against the air. And slow. These you can do with a band as well. So all of these things you can absolutely keep in your desk.
I think the beet juice is heavier than the...
Yeah. Those are the antioxidants talking. Slowly go down. And you can even do one if you have weights, or if not, just hold them right here. We could just move on and leave him here just holding them. See how long you can do it. And slowly go down. Great. So then the next one we're going to do are lunges. This one, I want you guys to, hold on to your chair. So if you have a reason, any knee injuries or a pencil skirt on or a mini skirt, whatever, and there's no reason you can't do lunges, please do not do so. Instead, I'm going to walk him through the lunges, and then I'll show you a modification. You can do squats in your chair. So but if you can do lunges, actually come forward so we can show everybody. And you can hold on to the side here. So you're going to put your right foot in front of your left foot, and then you're gonna just bend that left knee, but you're gonna make sure this knee doesn't go over the toe. So you see the picture in the card. Lunges can be painful if you don't do them correctly. So you are just gonna bend that back knee and front knee. You might need to widen your stance a little bit, and this is why you should hold on to the chair, because we're, there you go, perfect, now stand up. And you want to push through that front heel. So if your right foot's in front, push through that right heel to push up. And push up.
Push up.
Stand, yep. So you bend and push. So if you have a skirt on, you are just going to be squatting and standing. Squatting like you're sitting in a chair and standing. And don't actually sit. So up and down and up and down. Don't be pushing with your arm there. You're cheating. It's just for balance. Okay, now if you're doing lunges, put your left foot in front, right foot behind, bend down so your center is going straight down to the middle. Don't put that knee in front of that toe. Push up with that left heel. If you're squatting, you just keep on squatting. And use the chair so you know, because you want to get horizontal. You want to be 90 degrees to the ground. Wonderful, wonderful. All right, let's do 3 more. Down, up, 1, down, up, 2, down, up, 3. How you feeling?
Great.
Let's do 2 more, just because. 1 more. All right, good job.
Big hand for Jackie, please.
Thank you, guys. Feel free to take that home. Make sure you guys stretch out, and remember, any movement is great. So move as much as you can, and don't drop your weight.
Yeah, don't drop your weight. Okay, guys, give Jackie another hand if you would, please. Whew, I'm winded now. Okay, great. Next up, we're going to move off into our breakout sessions. We're going to have that mobile clinic tour set up, as I mentioned. To get to the mobile clinic, you'll go right out that door, kind of follow the hall around to your left, and you'll see an open door that'll take you to the outside. Please do stop by and check out the mobile clinic. Please proceed directly, though, now. Take your stuff and go to your breakout sessions. There are 3 of them. In the Amway Emerson room, which is the immediate door outside here, we'll do aligning business education and public health to create a culture of health. No, I'm sorry. That's around the corner. Then in the 3M RJR Nabisco room, we'll be exploring the intersect between healthy communities and business. Join me for that one. And then in the Lee Anderson room, which is this room right out here, we'll be using data and technology to drive community health. After those working sessions, join us next door in our briefing center for our Healthy 10 reception, followed by our Healthy 10 Awards luncheon right in here. You won't want to miss it. We will be giving away a Southwest Airlines round-trip airfare to anywhere Southwest Airlines flies, and a free Fitbit. So you want to be back in here. Ladies and gentlemen, give another hand for all of our speakers for this morning and yesterday, and we'll see you back here for the Healthy 10 Awards.
Ladies and gentlemen, the U.S. Chamber of Commerce Foundation Health Means Business campaign is proud to present the Healthy 10 Awards. Please welcome Mark DeCourcy, Senior Vice President of the U.S. Chamber of Commerce Foundation Corporate Citizenship Center, and Elise Cohen, Executive Director, Health Means Business Campaign.
Thank you, everyone, and good afternoon. What a great crowd we have. See, Richard was right. Everyone stuck around from this morning, and that's fantastic because you don't want to miss this. This is the culmination of our 2-day summit, and these awards are not just the end of the summit, but I think the beginning of the recognition that the Chamber wants to bestow on companies, on nonprofits, on partnerships locally and nationally that are working to improve a culture of health. Over the past 2 days, we've heard from across many sectors the importance of the business engagement in community wellness and health. The goal of the Health Means Business campaign is to foster strong businesses and their engagement in wellness of our nation's communities. And while the campaign helps business engage in wellness, we knew from the start that there were already businesses leading the way and forming these innovative partnerships that we're about to watch. That's why when we launched the Health Means Business campaign in 2015, just about 2 years ago in this very room, we knew that an awards program was a crucial component of the overall campaign. So it's important to recognize the accomplishments of those driving this impactful and important work.
That's right, Mark. This was a new awards program. So truthfully, we were unsure of the response we would receive, but we were blown away by the volume and caliber of the nominations. We received more than 100 nominations from partnerships and businesses across the country. The diversity of the nominations we received show the many ways the private sector is engaging in local communities to build a culture of health. Our panel of external judges, many of whom were able to join us today, reviewed the partnerships for strategic alignment, execution, and impact. Those with the top scores will be recognized today. A full list of this year's judges is available in the Summit program. We will announce the 10 winners of the Healthy 10 Awards. We will recognize 3 partnerships in each of the following categories: healthy community, healthy education workforce, and healthy environment. Additionally, we will announce 1 winner of the Healthy 10 Awards Partnership or Business of the Year Award.
But that's not all. There is also going to be 10 more winners today. Later in the program, we're giving away a number of great prizes, including round-trip airfare, SoulCycle passes, and a Fitbit. But you must be present to win, so no one can leave early, because you don't want to miss this. So before we introduce our awards MC and announce the winners, we'd like to thank those who helped make the Healthy 10 Awards possible. First, we'd like to thank the Robert Wood Johnson Foundation for their incredible partnership and support. The Health Means Business campaign is helping activate the private sector and build healthier communities, and none of that would be possible without their support. We also want to thank our judges. They're an esteemed panel. None of our staff were part of this, but these people, said they would be yes to being the judges. They did an amazing work. Now think about it, 130 nominations. That's a lot of homework that we sent their way, and they went through very thoroughly and thoughtfully and evaluated each of these.
We are incredibly grateful for our partnership with the Robert Wood Johnson Foundation and all of our partners that help make this program possible. Also joining us today is our MC for the awards program, Byron Pitts. Byron is an Emmy Award-winning journalist and co-anchor of ABC News Nightline. He is the author of 2 books. His second, Be the One, comes out in May. It's the empowering true stories of young people from around the world who've overcome a range of adversity, from civil war in Africa to bullying and child abuse here in the U.S. We are honored Byron could join us today. Please join me in welcoming him to the podium.
Thank you. Thank you, my friend. Hello, everyone. Let me rephrase that. Hello, everyone. How are you? You enjoying DC? Well, it's great to be with you. As a professional journalist, it's often my job to point out what's wrong in the world. But I'm so honored to be with each of you today as an example of what's right in our world, what's right in our great country, the important work that each of you are engaged in, your companies, your universities are engaged in. So congratulations to all of you. Because the work that each of you is engaged in is changing the world, changing families. It was Frederick Douglass who says it's far easier to raise a strong boy than it is to heal a broken man. And because of your work, you're making families stronger, making our nation stronger. So congratulations to each of you. As a longtime journalist, I need these. For those of us of a certain age, you recognize the value of these so I can hear you better. As a longtime journalist, I understand the importance of storytelling and sharing stories of impact. Today, we will share the stories from 10 partnerships that are building a culture of health and communities across our country. It's now time to announce the 3 winners of the Healthy 10 Award in the Healthy Community category. The Healthy Community category honors strategic partnerships that strengthen the competitiveness of the communities they serve through building and embedding a culture of health across geographic, demographic, and social sectors. It also honors businesses that are creating goods or services with consumer health in mind. Our first video will announce the 3 winners in this category and share their winning stories. After the video, we'll invite the 3 winning participants partnerships to the stage to accept their trophies and for a few quick photo ops. Let's learn more about the winners of the Healthy 10 Awards in the Healthy Community category.
Introducing the winners of the inaugural Healthy 10 Awards in the Healthy Community category. BD, Helping Build Healthy Communities. Nearly 24 million Americans live in medically underserved areas with limited access to health care. And of the few centers available to people, services are limited due to lack of medical supplies and personnel. To close the healthy equity gap in the United States, BD, Direct Relief, and the National Association of Community Health Centers partner on the Helping Build Healthy Communities initiative. Helping Build Healthy Communities helps local community clinics deliver primary and preventive health care services related to the prevention and treatment of diabetes, cervical cancer, and HIV. The partnership also helps clinics tailor programs for specific local patient populations and their cultural needs. To date, the partnership has awarded 26 healthcare centers more than $2.6 million in funding through the Helping Build Healthy Communities initiative.
Our collaboration has improved access to health care and helped improve patient outcomes for the most vulnerable populations in the U.S.
Enhancing care for children with asthma. Asthma affects 6.1 million kids nationwide. Poorly controlled asthma can impact a child's academic performance and can also result in missed workdays for parents who must care for a sick child. Healthcare Service Corporation's partnership with the American Lung Association of the Upper Midwest is helping fight childhood asthma. Their partnership identifies clinics treating a larger number of pediatric patients with asthma and provides a year-long training program focused on improving quality of care. In the program's first 3 years, 36,000 healthcare professionals and parents of children with asthma were engaged through training and awareness efforts, reaching an estimated 350,000 children. Lung Force. Lung cancer is the leading cause of cancer death among men and women in the United States. To address this issue, the Cancer Treatment Centers of America and the American Lung Association joined forces to build Lung Force, an initiative to fight and ultimately defeat lung cancer.
Together, we are putting the spotlight on lung cancer, and through Lung Force, we are fighting to save lives from lung cancer.
Lung Force has numerous strategic initiatives to aid individuals in need and help broader communities realize the health, environmental, and economic benefits associated with reducing the incidence and risk of lung cancers. Through raising awareness, improving prevention and early detection efforts, and enhancing treatment, Lung Force has helped curtail decades of stigma surrounding lung cancer. The Lung Force movement has engaged more than 100,000 consumers and nearly 1,500 local businesses across the country.
Please join me in congratulating BD helping build healthy communities, enhance care for children with asthma, and Lung Force. Well, that went like butter, right? Yeah. Congratulations again to our first 3 winners. We will now take a break from our award presentations to serve lunch. Enjoy. It's now time to present our second category, Healthy Education and Workforce. The private sector understands that a well-educated workforce is the key to America's long-term competitiveness. Many leading businesses also understand the link between wellness and education and how improving one can help improve the other. This category honors partnerships that strengthen the competitiveness of the communities in which they serve through improving educational outcomes and workforce development. This next video will announce each of the winners and why they are receiving this honor. After the video, we will again invite the 3 winning partnerships to the stage to accept their trophies and for a quick photo op. Let's learn more now about the winners of the Healthy 10 Awards in the Healthy Education and Workforce category.
Introducing the winners of the inaugural Healthy 10 Awards in the Healthy Education and Workforce category. CEO Culture of Health. The Memphis Business Group on Health, an employer-led action collaborative, plays a significant and vital role in promoting and supporting health in Memphis, Tennessee. Their CEO Culture of Health initiative promotes healthy company policies, programs, benefits, and cultures. While many initiatives engage the individual, workplace, and community, CEO Culture of Health focuses on empowering CEOs to become health champions. By driving health initiatives from the C-suite, the program is helping transform the well-being of Memphis communities. Today, there are 64 participating employers representing approximately 70,000 employees and about 12% of Memphis's county workforce. Participating employees have indicated that the greatest benefits they receive from creating cultures of health in their organizations are recruitment, retention, and productivity. Get Hype Philly. A growing number of Philadelphia students live in poverty and without access to healthy foods, recreational spaces, and employment opportunities. Children growing up in the city's northern neighborhoods live 10 years less than their peers. Get Hype Philly is a collaborative initiative led by GSK, the Food Trust, the Philadelphia Youth Network, and more local stakeholders. The program empowers youth to become leaders for healthy change through physical fitness, nutrition education, entrepreneurship, and civic involvement. Get Hype Philly's transformative youth-driven approach provides unique perspectives about the health barriers and resources needed to create sustainable solutions to better health in their neighborhoods.
Get Hype Philly is an innovative business and nonprofit collaboration passionate about improving the health, educational outcomes, and workforce readiness of young people.
To date, nearly 20,000 youth have participated in healthy programming, including 347 activities designed and led by Get Hype Philly's young people. Indiana Healthy Community Initiative. Active workplaces and communities are critical to the success for Indiana's economy. Indiana's obesity rate is 31.1% and smoking rate is 22.9%. At these rates, Indiana employees on average miss 2.7 more days of work, resulting in a loss of over $8.6 million due to lost productivity per year. To change this dynamic, the Indiana Chamber of Commerce and the Wellness Council of Indiana partnered with organizations across sectors to create the Indiana Healthy Community Initiative. This collaborative initiative focuses on developing a strong built environment, getting more citizen engagement, adopting policies that support health and wellness at work and in the community, and cultivating strong leadership by local businesses. By working in communities across the state, the Indiana Healthy Community Initiative is helping businesses, schools, neighborhoods, and more come together and develop a shared vision for creating quality places for people to live, work, learn, and play.
Please join me in congratulating CEO Culture of Health, Get Hype Philly, and Indiana Healthy Community Initiative. Let's give our winners thus far another round of applause. Our next award will honor the 3 winners of the Healthy Environment category. How a community is structured can have a tremendous impact on its overall health. The private sector often has the expertise, resources, and skills necessary to help improve the structure of a community to benefit its overall wellness. This category honors strategic partnerships that strengthen the competitiveness of the communities in which they serve through developing and improving the built and natural environments. Like our previous categories, our video will showcase each of the winners and honor their great work. After the video, we will invite the 3 winning partnerships to the stage to accept their trophies and for our quick, smooth photo op. Let's learn more about the winners of the Healthy 10 Awards in the Healthy Environment category.
Introducing the winners of the inaugural Healthy 10 Awards in the Healthy Environment category. Healthy Corners. More than 200,000 of Washington, D.C.'s residents live in food deserts. 36% of these residents live in poverty, and 42% receive nutritional assistance. In collaboration with Kaiser Permanente of the Mid-Atlantic states, DC Central Kitchen established the Healthy Corners program to bring healthy food into these communities. By working with convenience stores, schools, after-school programs, summer camps, and healthcare providers, Healthy Corners has become a sustainable, healthy food distribution system. The program also promotes lasting behavior and attitude changes by empowering children and families with the resources they need to shop, cook, and eat in healthier ways. The initiative has also been good for local business, as the program drives $69,000 in retail sales for Corner stores, and 96% of store owners report that Healthy Corners has increased the number of customers for their store.
We've helped more than 70 small businesses stock and sell healthy food and engage consumers through cooking demonstrations and community events.
Duke Energy Helping Home Fund. Poor air quality leads to chronic diseases that severely impact the health, well-being, and quality of life for low-income families. Duke Energy and the North Carolina Community Action Association developed the Duke Energy Helping Home Fund to improve the health, safety, and energy efficiency of low-income households. The Duke Energy Home Fund provides families with energy efficiency measures and upgrades like HVAC systems, new refrigerators, and appliance replacement of washers and dryers and room air conditioners. Families participating in the partnership are also educated on the value and benefit of energy efficiency and how it leads to a healthier indoor living environment. Since launch, this partnership has helped nearly 3,000 families have safer, healthier homes. Minneapolis Somali Language Food Safety Coalition. Somali restaurateurs are vital to Minneapolis's business community and vibrant restaurant scene. However, many business owners struggled to meet the compliance standards critical to food safety because of language barriers.
Together, the City of Minneapolis Health Department, the Minnesota Somali Chamber of Commerce, local Somali community, and Glow Consulting and Research, food safety trainer and evaluator, created the Minneapolis Somali Language Food Safety Coalition to help close service and equity gaps.
We did this project as partners, co-creating solutions based on the community's health needs and to support the business community.
By working together, policymakers gained a better sense of how to address cultural differences to communicate food safety issues with business owners and employees, as well as insights into Somali business operations that help the health department develop new best practices. In Minneapolis, a city with a strong immigrant-owned business community, greater inclusion yields equal opportunities for health and economic success.
Congratulating Healthy Corners, Duke Energy Helping Home Fund, and the Minneapolis Somali Language Food Safety Coalition.
Wide open spaces, room to make big mistakes. She meets new faces. She knows the highest stakes.
Congratulations to all the winners announced so far. Congratulations, guys. Now it's time to take a brief break from our programming for dessert. Right? When we come back, we'll have our giveaway and the announcement of our winner of the Health Means Business Partnership or Business of the Year. Please enjoy dessert. We'll be back shortly. Thank you. I hope everyone enjoyed their dessert and coffee. Before we give out the final award, we want to give people in the audience a chance to win today. We have some great prizes in this giveaway. Please see Brooks Nelson, the handsome gentleman, the bow tie there, to the left of the stage, following the program to pick up your prize. Good luck to everyone. Now, so we're going to draw cards out of a bowl. Thank you, ma'am. Okay, so this first is for one Fitbit. So the winner is from Suburban Hospital, Patricia Rios. Congratulations. Oh, right. So our next winner is from, I'm familiar with this company. You should. Too. Yeah, okay. Campbell Tomato Soup. Okay, so this goes to Kim Fortunata. And Kim wins five class pass to Soul City. And this next winner gets a 5 class pass to Soul City. This is from Scholastic. Casey Mindlin. Ooh, no Casey. What could have been? I'll go to the side here this time. Okay. From the Washington Redskins, Garrett Campbell.
I don't think any of them are here either.
I think there's a rule the MC gets it if the third person isn't here. Okay. From the North Carolina Community Action Association, Sharon Goodson. Congratulations. Congratulations. Our next winner is from CVR Community Ventures, Michael A. Finney. He was here, but he's not here now, so we're going to put him right there. Okay. Go on this side. Okay. From International Nutritionist, Patrice Armstrong. Count on us, Christine Harding.
YMCA.
From Stanton Chase, Mark Savanick. Close? Hey, Mark. And Mark wins a 5 class pass to Soul Cycle. And this is the last one, right?
Yep.
Okay. And the last prize is a round-trip ticket in the continental U.S. on Southwest Airlines. Ooh. From Seafood Nutrition Partnership, Linda Cornish. Congratulations. Congratulations, Linda. All right, congratulations to all of our giveaway winners. Thank you. It's now time for our final award of the program, the Health Means Business Partnership of the Year Award. A separate external panel of judges determined the winner of the Best Partnership of the Year Award. The winner of this award embodies the spirit and mission of the Health Means Business campaign. By harnessing the power of the private sector, the winner of the Partnership of the Year Award is helping to transform communities and build a culture of health. Their work creates both social and business value for the long term. Let's learn more about this year's winner. Please play the video.
Introducing the winner of the inaugural Healthy 10 Awards Business or Partnership of the Year Award. Los Angeles Fruit and Vegetable Prescription Program.
Los Angeles Fruit and Vegetable Prescription Program partnership is the first effort to formally leverage the complementary markets of a national corporate retailer, Target, and medical provider, Eisner Health, to Wholesome Wave, a food equity organization. This program, designed and led by Wholesome Wave, is working to make healthy eating an affordable choice for low-income individuals and families in the Los Angeles area. This partnership addresses the intertwined problems of obesity and food security, poor diet and reduced health, poverty, and lack of affordable healthy food option. By leveraging a multi-sector partnership with the power of a market-based incentive, Wholesome Wave has been able to improve community health as it relates to residents' behavior and lifestyles, while demonstrating positive mutual benefits for medical providers, retailers, and suppliers of fresh local produce.
Please join me in welcoming Michelle Nishan, founder and CEO of Wholesome Wave, and Margaret Henderson, senior policy advocate at Target.
Keep this very brief so I can turn it over to our partners at Wholesome Wave. But in 2015, Target announced that our corporate social responsibility strategy was going to evolve and focus on wellness. We know that wellness is a personal journey. It's about the choices that people make every day. But we also understand that there are barriers to wellness, especially around access and affordability. To demonstrate our commitment to making an impact, Target invested $40 million in 2016 to organizations across the country that were committed to helping children and families increase their physical activity and healthy eating. Wholesome Wave was one of our very first partnerships, and we're honored to receive this award with them.
Awesome. Thanks. Maggie, thanks so much. And huge thanks to the Chamber and to Robert Wood Johnson Foundation for having such foresight to support this work and to really get this summit to become a meaningful gathering for everybody. When I founded Dressing Room Restaurant with my late partner, the actor Paul Newman, I had this dream that healthy produce would become a right of choice that everybody could afford regardless of their income. And he said to me one day, stop talking about it, do something about it, found an organization and just get to work. And here we are 10 years later in one of the most amazing partnerships that we've ever had with Target. Once they really retooled their own internal corporate company values, they wanted to reflect those back into the community so that they could align with the communities in which they become successful. And to really see that the most vulnerable people in their community could really have vibrant lives, have access to make the same choices that we make when we want to feed our children well, that was something that was worth investing in. And it's because of that vision that they had and their generous support for us that Eisner Pediatric Health was able to serve over 2,400 family members through 600 index patients and make this incredible difference in their lives everywhere. This work happens now in close to 46 states, and we do believe that we soon are going to see a future where every living American, regardless of their income, can exercise that right to choose healthier food for their families. So again, thanks to the Chamber, thanks to Robert Wood Johnson Foundation, and super thanks to Target for the support and the belief in the program. Thank you.
Afternoons, hum and whistle to myself until I'm up again. But my heart plays in my nerves, one sad note after another, and it repeats itself.
Congratulations to the 10 outstanding winners of the inaugural Healthy 10 Awards. Please join me in giving them one last round of applause. On behalf of the Health Means Business campaign, I'd also like to thank Byron Pitts for joining us today and helping us present this year's awards. I would also like to thank the sponsors who made this event possible, especially the Robert Wood Johnson Foundation. We've also had tremendous support from our summit event sponsors, including BD, Medtronic Foundation, Chobani, Seaforce, Delos, Kind, Mondelez International, PepsiCo, SoulCycle, Stanton Chase, and Thrive Market. I'd also like to thank our media partners, USA Today and the Washington Examiner, the judges, Richard Crispin for being our amazing facilitator these past 2 days. And of course, thank you to the entire Health Means Business team and Corporate Citizenship Center. We could not have put this on without the force of the entire team. And finally, thank you to all of you for joining us at the summit and the awards. Health Means Business is a movement of leaders coming together for health. And without all of you, none of this would be possible. Congratulations once again to the winners.